for this second day of faculty development program on the forensic nursing, a short-term
Good morning,
course
ma'am.
collectively
Recording in
organized by the
progress.
Directorate General of Health Services, Nursing Division, Department of Forensic Medicine and Toxicology, AIIMS New Delhi, College of Nursing, AIIMS New Delhi, and Eco India. So today we are going to begin with our second day of learning in the forensic nursing. So to begin with the first session of this today's learning program, I would like to introduce our speaker of the present session. Dr. Abhilas who is currently working as a senior medical officer in the Department of Forensic Medicine, AIIMS New Delhi. Dr. Abhilas has worked in many organizations at different capabilities. He has 14 publications in his credit in the national and international journals, and he has attended and presented the many papers in the conferences, workshops, and the symposia also. And now I request Dr. Abhilash to start the session on violence against the children and POCSO Act, role and responsibility in the hospital center. Over to you, Dr. Abhilash. Yeah, yes, ma'am. Actually, he was already done.
So you are muted. So you're not audible, sir.
Recording stopped.
Yes, ma'am. From here, mic and camera is on. Dr. Abhilash, we can't hear you. Sweta, is it audible to your side, to your end?
No, ma'am. It's not audible.
Okay. Dr. Abhilash, are you there? Okay, fine. हमारी तरफ से तो ठीक है ना कमल या
हमारे एंड पे सब ठीक है तो जा क्यों नहीं रहा है
लाइव नहीं जा रहा है
लाइव तो जा रहा है ये आगे
नहीं एक मिनट उनका कुछ इशू है
Sir, can you check the other audio, like the audio device, like Bluetooth earphone? Then we can resolve. For example, got disconnected.
Manjit, please keep a note. He must be reconnecting, na?
Sorry?
He has joined. Dr. Abhilash has joined as guest. Please make him co-host.
They are done. Hello, sir, can you, yes. Sir, can you connect the Bluetooth earphone? Might be problem in audio to my laptop. सर एक बार ब्लूटूथ ईयरफोन यूज कर लीजिए सर लैपटॉप का ऑडियो से प्रॉब्लम तो आप ब्लूटूथ हो या ईयरफोन हो आप यूज कर सकते हैं उसको।
Hello, good morning. I hope I'm audible now.
Recording in progress.
Yes, sir.
Sorry for the technical glitch regarding the audio problem. So let's start the session today, and today's session would be regarding Violence Against Children POCSO Act, role and responsibilities in hospital settings. So this is a very common topic which we come across in daily newspapers, violence against children, POCSO Act being enacted on certain acts against children. So the only thing which comes to mind when the word violence against children is used is either physical violence or the sexual violence. But violence against children is a much bigger topic which includes a lot of additional things like emotional factors, something like an emotional neglect, and also a psychological neglect, a physical neglect. So I'll be briefly covering these topics because it's a very broad topic. I'll just be presenting certain cases which we have encountered here in AIIMS, so that it'll be much easier for the audience to understand what exactly is violence against children and what is the role of doctors and the nursing staff, and if we are planning for a forensic nursing, so what is the exact role of these medical fraternity in violence against children and how to prevent this. So first of all, let's come to the prevalence of this condition. As I told, it's a very common topic. When we come to the global prevalence of this, so this is the global scenario when we consider the UNICEF data. So here we can see around 3/4 of the children of around 2 to 4 years are usually subjected to physical violence. And when we consider this is around 75% of the kids who are involved. And when we come to know about the sexual violence, the global criteria shows that around 18% of females are subjected to sexual violence, and when it comes to males, it's around 8% who are actually involved. But it's a clear known fact that these figures are way too less than what exactly is the actual scenario. There are multiple reasons for this, and I'll be discussing them in detail in the coming slides. So overall, when we consider the sexual violence, when it's related to sexual violence, it's usually the female victims who are more constituting maybe around 80% of the victims. But it is not that male victims are not there, male child victims. Nowadays, even male child victims have increased a lot, but the reporting of these cases are very less because of a lot of social stigma which is present regarding this. And there is another set of completely different level of violence, which is homicide of violence against children. So when we consider this, the data is a little different here. If we consider 10 cases, usually around 7 cases are males. So when it comes to the violent type of abuse of children, it's usually the males who are involved, and when it is related to sexual abuse, it's usually the females who are commonly involved. So this is the global criteria. So when we come to the Indian scenario as such, the National Crime Reports Bureau is the statistic index for India. So in 2020, it clearly showed that majority of these violence against children occur in the form of kidnapping and abduction, which accounts to around 42.6%. And next common is the POCSO or sexual offences, which account to 38.8%. And here you can, on the right side, you can see the yearly graph from 2016 to 2018. There is always a continuous rise in the violence against children, and there is no decline, or even it's not equal. So there's an important need for breaking this chain and preventing violence against children at the current scenario. And when we come to the lower graph, here we can see, when we consider the POCSO cases, majority of the cases, around 90%, 95%, is usually females around the age of 12 to 18 years. They constitute the major part. But as I told, males are also common victims for the child abuse, but these are usually underreported in the society, mainly being they have a social stigma that how can they bring out the news that a boy has been sexually offended or sexually abused. And sometimes the reason being, most common in these sexual offenses are relatives who are involved. Sometimes it is their own father who is involved. We have seen cases. So in such cases, the social stigma will not allow people to report cases of sexual offenses. So let's. This is an important topic, violence online. Though this is not something that medical fraternity can do anything about, as we know that the use of mobiles, the use of internet has increased a lot in the current situation, because of which these types of violence, this is called as online violence, has increased a lot. So when we consider the user data in India, around 60% of the online users in India are children and young people. So when they are using like unchecked and unnoticed by parents or any guardians, there is high chances of them being involved in some bullying, cyberbullying. This is called as cyberbullying, and also violence online. This could be in the form of children being exploited for images, sexual abuse pictures which are uploaded. And the US data shows around 25,000 images of child abuse are uploaded every day from India. So this is a very large and scaring data, and it needs an immediate check and stopping of this. So this is the reason the Central Bureau of Investigations in India has started a special wing recently, last year, and this is mainly to check and stop these online violence against children. So we have encountered two important cases in this, and in further slides I'll be discussing these two cases with you people. So as a medical fraternity, when we are working either in the casualty, in the OPDs, in the general immunization program, we come across children. So usually we need to know some basic factors like risk factors which can put these kids for abuse, and certain red flag signs which we have to look for, which helps us identify that there is abuse going on. No child will directly tell that they are being abused, because most of the time they lack the knowledge of abuse and what is proper, what is wrong. So it's our duty as a medical fraternity to stop this child abuse. So first we need to know about the risk factors for this child abuse. Most common risk factors is the parents or the guardians lack the knowledge of what is exactly child development, what is normal development, and what is the proper care which the child requires at a particular age. This lack of knowledge is one of the major factors leading to abuse in most of the cases. And another important common, especially in uh, the country developing countries and also in India, is the financial restraints the parents or the guardians have when they are planning to support the needs of the child. This is one common cause. And the other most alarming cause is substance abuse. We have commonly come across this when, especially in the Western, we have seen that use of drugs, use of alcohol is the major cause of child abuse. In India also, the recent trend because of increased alcohol consumption, then increased domestic violence because of alcohol consumption and drugs intake, has been the major risk factor for child abuse. And there are other associating factors like broken families, single parenting, psychological problems related to the parents or guardians, which result in child abuse. This may be in the form of just physical neglect or educational neglect for the child. They stop giving proper food, proper nutrition, which hampers the growth of the child. But sometimes may also involve physical violence or sexual violence as well. And the last one, which, as I already told, the new form of online violence is usually due to unmonitored use of mobile or internet by the parents or guardians. This leads to some cyberbullying and related problems in kids. So the next important factor which we have to consider in child abuse is the red flag signs. This is very important as a medical team, because when we are coming across kids, it's our duty to identify these red flag signs and suspect that there's a possible abuse in this kid, and we have to intervene at that point. Otherwise we may be completely letting go of the child's future and the child's entire mental image at that point. So what are the things which can show that there is probably a child abuse? So one thing is the parental delay in seeking care for an injury. So the child sustained an injury 1 week back, the parent is coming way later, giving reasons which are usually not acceptable, like something related to work or some personal reasons which are usually not acceptable. And there is incongruence between the description of how the injury occurred and how the injury actually looks like. For example, the guardian or parent may tell like the kid just fell off the bed, but when you're examining the kid you may find multiple fractures in different sites. So these two are not correlating with each other. This is an important factor and red flag sign for abuse. And when you're examining the kid, you see signs of extreme anxiety in the kid, or there is a fear that when you're about to examine the child. So this is an important sign. And otherwise, sometimes when parents are not the abusers, maybe the guardians, or in school they have been abused, in such cases the usual complaint would be sudden change in behavior of the child or change in the school performance. Like a good performing child will suddenly stop studying properly or performing well in the exams. And another important feature is secondary bedwetting. Usually, bedwetting is a common thing in kids, but they usually gain control by around 5 years of age. But after that, if they start wetting the bed, usually these are probably one of the risk factors or red flag signs for child abuse. And they having some repeated urinary infections, difficulty in sleeping, and poor hygiene, all these things. And overall all these affect the developmental milestones to be reached by the child, so you may find developmental delays. This also should trigger that possibility of abuse in a child. So the government of India has taken a lot of steps, especially to prevent the sexual abuse of child. And POXO was an important step which the government of India took to prevent the sexual offences against children. So POXO stands for Prevention of Children Against Sexual Offences. It was passed in 2012, and this is an important landmark judgment and act which was introduced by the government, because before this there was no clear set rules for handling cases of child sexual offences, and the punishments were not so severe to punish the offenders. So the offenders used to repeat the same offences again and again. So in this case, POXO was introduced because major part of the risk group is 5 to 12 years, and usually the abusers are people who the child trusts or knows, or sometimes even the people in authority. This could be we usually have the idea that some outsider usually abuses a child, unknown people come and abuse the child, but that is not the actual scenario in practice. The most common abusers are trusted people, probably relatives, friends of parents or guardians, people whom parents trust and hand over the child to be taken care of. They are the most common people who abuse children. So everyone has to be aware and keep a check of even the known people to prevent such things. So why was the POXO passed? Mainly to prevent the offences against sexual assault, harassment, pornography. Kids are usually pushed into pornography unwillingly, and they don't know the consequences of what is happening with them. And also to speed up the trial and to establish special courts. So important part and feature of POXO is they started POXO courts for these kinds of offences. These courts speed up all the trials. They create a child friendly environment even in the process of trial and in the court proceedings. Like the child need not go to the court or police station to give the statement of the offense. The police officers or whomever related come to the place where the child is comfortable, and they are not supposed to be in their proper uniform of police. They are supposed to be in a civil uniform while taking these things, mainly to reduce the anxiety for the child. And this is an important step for speeding up the procedures. So next important thing is, what are the salient features of POXO Act? So this act covers all under 18 years of age. It mainly focuses on providing emergency medical care. This was an important issue earlier because everyone was scared whether they are permitted to provide medical care, whether this is a police case, a medical legal case, should they wait for police requisition. But POXO and the related acts cleared this doubt amidst the minds of the medical fraternity that medical care is the most important thing and they should not wait for any requisition from anyone to provide this medical care, and protecting the privacy of the child. Yesterday, Dr. Swati, when she was talking about One Stop Center, has clearly explained in detail about the need for protecting the privacy and how One Stop Centers promote this protection of privacy, and also providing all the multidisciplinary services which the child needs at a single point without making the child to move around in different places of the hospital. And also it focuses on treating injuries, the possible infections and pregnancies due to these POXO acts. So coming to the main topic as such, what is the role and responsibility of medical fraternity in a hospital setting? So here is a newspaper clipping. This is from Kerala, Hindu Times. So we all know, as a part of our routine duty, we as medical fraternity know that we encounter number of cases every day, and we have a very hectic schedule. In these hectic schedules, we forget the empathetic part of our medical system. The reason is most of the times we are overburdened and we don't have much time to spend on a single case. That is understandable, but problem is these are special cases, especially the child abuse cases are special cases, and an empathetic approach is the most important step in these cases. So what exactly and why is it needed? When we answer these questions, when a child just narrates its story once after the incident, it is again re-traumatized. In the same scenario, if it is asked to repeat the history and what happened with it multiple times, it is like causing multiple child abuses from the medical fraternity side. So this has to be avoided, and the doctors also have to provide a very safe, and privacy has to be provided to the child, and the child has to be kept calm without asking leading questions of what happened. They have to let the child be calm and then explain exactly what happened with it. And most of the times we may not be able to force the child to give the exact details because it's in a state of shock. So we need to understand the condition of the child in such situations. So we need to establish standard operating procedures in the hospitals to prevent these complications or harassment for the child when it comes for examination. This is basically to provide a comprehensive service for smooth handling of cases, and the most important step is clarity of role of each staff. Why is this important? We all know with multiple specialities involved in medical science, there's a lot of overlapping. For example, if a female sexual offense case comes with genital injuries, there's always a clash whether the pediatric surgery team has to be called for examination or whether the gynecology team has to be called for examination. So if the hospital has a standard operating protocol with preset rules that this particular team will first approach, and if required the second team will be called on, then the child need not waste much time and will get the immediate and necessary care on immediate basis. So every hospital needs to have a standard operating procedure for this purpose, and it's not mandatory that all the time gynecologists have to examine the female children. It's a requirement. If available, a female examiner is required, but sometimes it is not the case. In such cases, in the presence of a female and with consent, we can proceed. A male examiner can also proceed with the examination. Their main reason is there should not be delay in examination and collection of evidences. So another important thing is if there is a minor, a person with disability, they have to be given special and extra care required for that particular case. And during examination, we have to make sure that police personnel are not entering the examination zone. This is the reason for this is maintaining the privacy of the child and also giving it confidence that it can trust in us and give the exact information of what happened in that incident. So use of safe kit has already been explained yesterday by Dr. Swati. And coming to the objectives, why exactly do we need to do a medical examination in child abuses? So the main purpose is, first of all, to know whether the incident which has been described has actually occurred. We do encounter cases where fake incidents are reported for some rivalry purpose. Usually kids don't give false reports or false histories, but there are scenarios where they are forced to give false histories, probably because of guardians or parents rivalry with some other relatives or neighbors. We have come across such cases. So as a medical fraternity, it's our duty to correlate the findings and check whether actually this incident has happened and the medical evidences is showing the presence of these, and whether confirming and denying the alleged offense is an important reason and objective for examination. So when it comes to sexual offense cases, we have the purpose of our examination is to know whether there is an attempt of sexual offense or there's a completed act of sexual offense, and also whether any harm to the body and mind of the child has occurred, so that our treatment is focused for that particular thing. In some cases, in POXO, age of the survivor has to be given by the medical examiner. This is a very common situation which we encounter. Reason being, POXO defines everyone under 18 years falls under POXO and they are considered to be children. But most of the eloping and sexual offense, it could be consensual sexual offenses also sometimes, happens in the age group of 16 to 18 years. This is a very tricky age group, and usual histories go that the child will be stating, I am above 18 years and I have the right to decide my partner, but parents will be claiming that the child is below 18 years. This age group brings a lot of confusion. In such age groups, we need to determine the age of the survivors, so that we need to determine whether it falls under the POXO Act or not. And also, we need to rule out possibility of alcohol and drugs administered before such sexual acts. So after all these examinations and the evidences which we collect, we need to interpret all these findings and results. So these interpretation depends on a number of factors. First of all, interval between the incident and examination. Why is this important? In the practical scenario in hospitals, we see cases coming after weeks, months, and sometimes even after years. This is a very practical situation. We know that we will not find any injuries in this case. We will not find any positive seminal stains in this case. But it's our duty to examine this case without denying, and we need to record this time interval, which shows that possibility of finding these things is very less in this case. And other related things, it will be dealt in detail in the next session during examination of a victim of sexual offense, regarding why clothes needs to be mentioned, whether it's changed or not, whether washing of private parts is done, whether menstruation is done or not, and number of people involved is important. Reason being, kids can be easily overpowered in most of the cases. Even one person can overpower a child. So finding struggle marks in kids is usually rare. So absence of struggle mark, the medical fraternity who's examining should not come to a abrupt conclusion that it was a consensual sexual act. We have to consider possibility of being overpowered or involvement of some alcohol or drugs in such cases. So the general information, police requisition, as I told, is not mandatory, but we need, if we are coming across any abuse case, it's our duty to register MLC and inform the police. This CRPC 39 is what compels us as a medical fraternity to register MLC in such cases and inform the authorities regarding it. And there's a separate session on the judicial aspects of these offenses, and we need to take written consent. And in the age group of 16 to 18, we have another common problem is they usually deny examination in such cases. The survivor or victim denies examination. In such cases, it's our duty to take an informed refusal, which should be documented properly for the purpose. So again, we all know regarding the consent purpose for general examination, usually 12 years is taken, and for invasive procedures, 18 years is the age of consent. So what should be asked in history from the medical fraternity? It could be the forensic nurse who first encounters such cases. It could be the nursing faculty. It could be the doctor who first encounters. They need to know what type of injuries were inflicted by the assailant on the victim, so that our examination completely covers that. Sometimes if there was an anal intercourse on the child and externally no injuries are seen, it is our duty, because the history is telling that there's an anal intercourse, we need to examine the inner aspect of the rectum for any injuries. But if there's no history of any anal intercourse, it is not required to do a procedure of proctoscopy and examine the anal orifice. So we need to differentiate what examination and what samples have to be collected and what not. All cases need not require all samples. And during the general examination, we need to check the mental status, whether the child is stable or not. We need to morally support it first, check the gait if it has any painful gait. Vitals should be stable. That's the most important thing. And this the reason is, as a medical fraternity, treating the victim is our main priority, and secondary to that is taking history, examining the victim, and third, collecting the forensic evidences. All these comes after stabilizing the victim and treating the victim. So our main duty is to treat the victim of child abuse. And we have to look for signs of intoxication, because we need to collect samples for chemical analysis to rule out any drugs like rape drugs or alcohol being involved in such cases. And we have examination of clothes, which will be dealt in detail in the next session. We need to examine the injuries. Abdomen is one tricky part, usually because of the soft nature of abdomen. Externally, no injuries are usually seen, but we need to make sure no internal traumas are there in abdomen. And in sexual offenses, abdomen is one common place where the child can be injured. So there are some certain precautions while we are responding to children. One thing is, abusers themselves could have brought the child to for examination. In this case, if you are suspecting possibility of an abuser accompanying the child, it's our duty to separate the child from the abuser, keep it in a safe custody, and then take history in the absence of these abusers around the child. Because when the abusers are with the child is in constant fear and may not give us the right information which is required. And maintaining confidentiality and privacy is very important in this case. We need to look for the indicators of abuse, the red flag signs, which I've already discussed. If the child is not comfortable with a male doctor, it is our duty to call for a female support. It could be a female doctor, a nursing staff, a forensic nursing staff. Whoever is trained to extract history from this particular child is required in such scenarios. And another defined scientific method for taking history from a child, especially the touch part, is by using a doll or a body chart. There are specific scientific literatures of training the medical fraternity for extracting the history from the child by using these dolls. And all of us have to be trained in this particular part because it is very crucial. Children are completely different from adult, and the way of expression is completely different in children. So we need to understand the language of children and interpret these findings. So also believe the words of the child. Most of the time, the child will not manipulate things. It usually tells what it understands, and it's our duty to interpret the understanding of the child properly in most of the cases. And evidence to be collected. Already this topic has been covered by Dr. Abhishek Yadav sir, and it will be covered again in the subsequent sessions which are going to come now. So in total, a brief one, we will be collecting general evidences like clothes, bodily evidences like photographs of the injuries, description of the injuries, genital anal evidences possibly in the form of swabs or smears, toxicology in the form of blood and urine for toxicological analysis, microbiology to ruling out sexual transmitted diseases, control samples to be taken in all these cases, and other samples in relevant cases. So what is the key part in handling these samples? First of all, collection is the most important and the crucial step in all these evidences, and collection has to be done as early as possible. Usually it is defined within 72 hours, but practically this is not possible because most cases come after a week or two. So ideally it should be collected at the earliest possible time. So the swab, already Dr. Abhishek Yadav sir discussed about this. This swab has to be air dried. We have a mistake which we have seen even in the casualties. Once the swab is taken, it is usually wet and directly it is put into the paper envelope. There is high risk of fungus being grown on this the swab, and the DNA material will deteriorate if the fungus grows. So it's our duty to make sure that the air drying has happened properly, and we need to maintain proper containers which are tightly sealed, labeled properly, sealed properly, and stored in a secured place, and avoiding mixing of these samples. Maintaining chain of custody is the most important part in any evidences. So these are the other corroborative evidences. This will be covered in the next two sessions coming up, related to all other injuries, hairs, foreign bodies in the victim. So I'll start with few case discussions. This will be a short one. Around 4 to 5 cases I'll be discussing which we have encountered. We all know battered baby syndrome. It was first presented by Henry Kemp. It's also called as the Kemp syndrome. So we always have in mind that child abuse is physical. As I already told, it involves sexual abuse, emotional abuse, physical neglect. All these components are also part of it, but physical abuse is one common thing which we encounter in the medical case scenarios. In this battered baby, usually it's quite common, and the first case which I'm going to discuss, the male child was around 7 to 8 years, was brought by mother with history of suddenly change in the behavior of becoming quiet over past few weeks. The child was continuously avoiding eye contact, and the mother told the child has reduced playing for past few weeks. So this is an unusual feature for a child of 7 to 8 years who was full of energy at that particular age. And the history was parents used to go to work, both mother and father, and during this time they used to leave the child in a caretaker with a caretaker. So after 1 or 2 weeks, the mother started noticing some injuries, but when they asked the caretaker how such injuries occurred, the caretaker used to present some stories that the child fought with another child and sustained injuries. The child again suddenly fell while playing, because of which the child sustained injuries. Initial few times, mother understood, okay, that is a possibility because the child was a bit naughty. But after that, it was a little suspicious for mother that so many injuries are occurring for past few weeks. So seeing these change, the mother brought the child to the hospital, and in the casualty we actually found important, I hope it is visible, these are the arrows are indicating nail abrasions, small nail abrasions because of violent handling of the child in the neck and upper chest region by the caretaker. Usually mothers usually observe small injuries, but sometimes these are some types of injuries which can be missed because of the small nature. And the injuries over the back, the history was given the child fell from the stairs, but when we examined these injuries were of multiple injuries were there, and all these injuries were of different ages. They were not corresponding to the history which was provided by the caretaker. Again, over the elbow, usually on the posterior aspect, the child had sustained multiple injuries. The reason for this was the child was violently pushed by the caretaker multiple times whenever the child started crying. And this was one recent injury which the child had occurred. You can clearly see the red circle. Inside the red circle, three almost parallel contusions are there. This was due to slapping on the thigh. This was done by the caretaker in order to control the child. Because of this continuous physical abuse on the child had changed its nature and had become quiet, had stopped playing. This is an important sign which the medical fraternity have to examine in the casualty, because the child, if left like this, will have a permanent damage on its brain and personality, which will lead to a number of complications which I'll be explaining in the next case. This is again on the buttocks. It had injuries of different ages. Few were healing, few were fresh, few were very old. So this is an important red flag sign in cases of physical abuse of a child. So what is the duty of medical fraternity in such cases? It is our duty to register medical legal cases, and the police have to be informed. The child welfare committee has to be involved in handling such cases, because if the parent was the abuser in this case, the child welfare committee would provide a safe environment for the child to stay in the for the coming days. So if you're suspecting that the supervisor is doing, keep the child safe in a place where the supervisor or the guardian who has accompanied the child is not having access to the child. And also we need to do a skeletal survey to check for any fractures in any part of the body. So the next case, this was a male child of age around 6 to 7 years. Here the history was the child was sexually abused by own father. So it was a male child, and usually we have seen the statistics in NCRB and global statistics. It states that usually females are the commonly sexually abused kids, but in practical scenarios, male kids are almost equal, even though may not be equal, almost equally abused for in sexual offense cases. So, what is the important thing? As a medical fraternity, we need to do head to toe examination completely, including the orifices in kids. Reason being, the only finding in this case was the injuries seen in the around the anal orifice. So the arrows, apart from the arrows, there are other injuries. These are lacerations seen in the anal orifice, and also you can see the tone of the anal tone has also reduced because of repeated offense on this child. Usually in younger age, because it's a very painful procedure for this examination, we do the examination under general anesthesia, but this is not a compulsory thing. If the child is cooperative and if you are able to do the examination, general anesthesia can be avoided and examination can be done. But sometimes if lacerations are present, definitely the child will not allow you to examine these intricate genital regions and anal regions so easily. In such cases, we need to seek other medical specialities help, like the anesthetic help, and do the examination. So it's usually described as a clock. The child is placed in lithotomy position, and 6 o'clock, 9 o'clock, 12 o'clock, and also in 1 o'clock position we have lacerations. And apart from these deep lacerations, there are much more superficial lacerations in this case. So this is a second case. This female child was 6 years old, and again this abuse was caused because of a caretaker or a relative or who was living with the child when parents were out. So here, as we saw in the previous case, injuries need not be seen so extensively in all cases. In some cases, as in this case, only one laceration is seen, and here also examination was done in general anesthesia. Here a laceration can be seen in the 9 o'clock position. So we need to keep our mind open. In certain cases, there may be no injuries at all, but we need to consider other factors like history from the child, other examination findings to come to a conclusion regarding sexual abuse. And whenever any medical fraternity has any suspicion, even a small suspicion that possibility of child abuse is there, involving seniors is the most important thing, as experience always counts in such cases, and they require these expertise to come to a conclusion whether abuse is there or not. And the usual history given by caretakers is the child has constipation, it has sustained injuries in the anal region because of constipation. But as a medical fraternity, we have to be trained to differentiate these injuries which can occur due to sexual offense, and also the ones which are occurring due to impacted stools or due to constipation. So this is the case which was discussed yesterday also multiple times. The Chitrakoot case, this was the medical team where 5 medical team members from AIIMS, we went to Chitrakoot to examine around 25 kids, but the total number of kids who were victims were around 50. And also the 6th doctor is from the district hospital in Chitrakoot who helped us in the entire procedure. So the important thing in this case was the AIIMS medical team initially examined the accused in AIIMS. The accused was brought here by the CBI officers. The reason for us examining the accused first was we were supposed to examine a large group of kids on the coming days. So we were supposed to examine for some sexually transmitted infections in the accused, possibility of some other infections which the accused could have transferred to the kids. So we had to first examine the accused, make sure there are no STDs which the kids needed treatment for, and then we went for examining the kids. And as yesterday already discussed, we examined the kids in batches. And the history, when it comes to the history, the suspicious part was, even though there are 50 victims in this case, not even one complaint was lodged against this accused. The reason, these accused along with his wife were a couple without any kids, and he was a respectable officer in the Chitrakoot area, and the people around, his neighbors, had a feeling that because they didn't have children, they were very close and friendly with all the children. They used to call these kids to their house. They used to give them some chocolates, sometimes money, and also he had bought a PS4 for the kids to play so that they could come back again. So during these times, he used to commit these sexual offenses on these kids. And the surprising thing was, all kids in this case, 50 were male kids in this case. And most of the time, the victims were known to the accused. It was usually the maid's son, it was a relative's son, it was neighbor's son, it was a person who was giving milk daily to the house. So usual victims were, the targets by the accused were known people whom the others will not suspect. So similar to this, in last year we got another case from this special branch CBI. A similar case of multiple child abuses were encountered in Goa and Maharashtra, Bilwandi. This case is currently running and we are yet to examine the victims in this case. So here again, the accused was doing this child abuse for the past 15 years, and there was no check for this. The interesting fact in these two cases, the Chitrakoot case and the Goa case, was in the Chitrakoot case, the younger kids who were abused around 10 to 12 years back now had turned themselves into an accused. So they were abusing the younger children. And this Goa case, the accused who was there was actually himself a victim in his childhood. So he was abused by his uncle. Multiple people used to abuse him repeatedly. So later on, as he grew, he turned out to be an accused himself, causing these abuses. So child abuse is a very sickening thing. It spreads like cancer. You have to stop this. Otherwise, the victims now will definitely turn out to be accused in the near future. So if we don't stop this procedure, these events, we will be morally responsible for not recognizing such things when they come to the hospital, and it's a social threat as a whole. So finally, coming to the summary of my presentation, so medical fraternity play a very vital role in identifying and preventing such abuses, and we need to give these children who are very vulnerable a very special care, and a follow-up has to be maintained in such cases. Wherever it is, the medical team always have to keep this child abuse on the back of their mind, so that they have to look for the red flag signs, and this chain has to stop. Otherwise, the child abusers keep multiplying without any stop. And as an advice online, parents have to take care and educate their children regarding good touch and bad touch, which is an important thing they need to understand, so that such sexual offenses and physical abuses are avoided in the future. Thank you.
Thank you to Dr. Abhilash. Such a deliberate and there's an explanations, and we come to know most of that POCSO Act, and for the especially for the country in which that most of the populations and that the young population are higher presentation. Um, Ma'am, as we are running behind the time, are we going to take up some questions from the participant? Sweta, do we have the questions in the chat box from the participant? Okay, we can take up that one question and move forward. Can you please read out?
So there is a question for you. Kindly explain what are the issues related to feasibility, ethical and legal implications regarding the mode of service delivery while handling the critical situation.
Uh, it's like I hope the question is related to the pediatric and the child abuse. There are a lot of ethical and legal issues in handling a child, especially when it comes to consent. The major critical age group, especially, is 12 years to 18 years. In this age group, the clash happens is whether the child can itself decide whether it needs examination or not, because sometimes the parents want the child to be examined, especially if it's a consensual sexual act. The child doesn't want to be examined and any samples to be collected, but the parents want the child to be examined and samples to be collected. In such scenarios, if the child is more than 12 years, usually the child has the right to decide what has to happen over its body. So we can't force the child to undergo any examination, because it is against
Against its privacy, and also it's not legal for the child to get examined, and we need to take a refusal consent from the child after explaining all possibilities and all the outcomes in such cases, and continue with the remaining part, whatever is left. I hope I have explained what was intended.
Thank you, sir, for your input, sir. And then, so now we are having more questions. What do you mean by UV examination?
Sweta, if we don't have, we'll just answer this question now. The remaining question we can take up in the I think coming session, because we are running out of time and all the speakers are already present over here.
so So UV examination usually is ultraviolet lamp examination, which we usually do in the forensic department to identify presence of stains. So especially if it is seminal stains, when we flash a UV light in a dark room, the seminal stains usually give a fluorescence, a special color. So it will be easier for us to collect these swabs and also to collect the samples, even if it's over the body, which we can usually know the place of these stains. Though they are dried, they have that nature of reflecting a special color when UV light is reflected over them. Thank you.
Okay, thank you once again, Dr. Avilash, for clarifying the doubts and for the wonderful session that have been delivered for our participants. Thank you so much. Now, without wasting much time, I would like to call upon our next speaker, Dr. Kulbhushan Prasad Singh. Kulbhushan Prasad sir. Sir is working as an additional professor in the Department of Forensic Medicine, and the sir has been working in the AIIMS since 2014 in the different levels. And the sir is investigator and a co-investigator in many funded projects. And sir has 17 papers in the index and a non-index journal. And sir has got many awards. And sir is a live member of professional bodies, committee members for UG and the PG teaching program. And sir also contributed tremendously in the society during the COVID pandemic. And sir is the editorial board member of Journal of Forensic Chemistry and Toxicology. Sir was a member of the Committee Center of Advanced Research and Excellence in Virtual Autopsy and in many sensitive cases that happen in India. Sir has guided and co-guided many PG and the PhD students. And now I welcome Dr. Kulbhushan sir to deliver his session on the forensic examination of the survivors in the sexual offenses. Over to you, sir. So you can come this side. This will be the center. Yeah, this will be the center. Is it comfortable, sir?
Am I audible? Very good morning to all of you. First of all, I would like to congratulate all the nursing professionals and all the team members who has done so much hard work for this session, and in collaboration with our Department of Forensic Medicine, AIIMS New Delhi. As we all know, nursing professionals, they are doing very hard work from the last 20 years or 15 years. But still, their hard work is not recognized in our country. So the main motto of this session is that we have to encourage our nursing professionals, and we have to depute their duties in forensic medicine department and in the casualties for their trainings. So today we'll briefly discuss about the forensic examination of the survivors in sexual offences. As we all know, the crime of rape, that is sexual offence, it is a major problem in India. But the acquittal rate is very low. Around 20 to 30% is the persons they are acquitted. Why they are not acquitted? Because of that 3 or 4 reasons. It may be the lacuna in the law, or the victims do not file a complaint because of the fear or because of the harassment in the future, or from the part of the medical professionals or the nursing professionals that we have not collected the evidence properly. So in India, according to the survey, one rape is committed in every 29 to 30 minutes. And as I have already told you, 20 to 30% only accused, they are convicted. And the conviction, it totally depends on the medical examination performed, and during the examination, what the evidences we have collected. So it is our duty, of the physician's duty and the nursing professional's duty, to properly examine the accused and the victims, and to collect all the necessary evidences properly. So what are sexual offences? They are further categorized into the natural, unnatural, perversions and sex-related crimes. In the natural, it comes rape, which I will discuss in the future slide, incest, adultery. In the natural, there is bestiality, that is having a sexual offences with the animals, sodomy, having the internal anal intercourse, buccal coitus, perversions. It is further subdivided into the sadism, masochism, transvestism, and voyeurism. And the others are sex-related crimes. As we all know, there is prostitution rackets are there, indecent assaults that comes into the 354 IPC. So, as we all know, in 2012, Nirbhay Kand was there, Nirbhay case. I think we all are aware of that. So, before the 2012, the definition of rape is different. But after that Nirbhay rape case, the definition of rape that comes under the 375 IPC, it has been totally changed, which describe as if any person penetrates his penis. This definition we cannot change, or we cannot pronounce into our language, because it is a legal language, which defines that if any person penetrates his penis to any extent into the vagina, mouth, urethra, or anus of a woman, or makes her to do so with him or with any other person, or inserts any object or part of the body not being the penis. Please remember, not being the penis. It is any object into the vagina, urethra, or anus of a woman, or makes her to do so with him or any other person, or manipulates any part of the body of a woman so as to cause penetration into the urethra, anus, or any part of the body of such a woman, or makes her to do so with him or any other person. Or if the accused applies his mouth to the vagina, anus, urethra of a woman or makes her to do so with him or any other person. Under the circumstances falling under any of the descriptions, like firstly there are 7 clauses. Firstly, if against her will, without her consent, if her consent has been taken by putting her in any person in whom she is interested in fear of death or hurt. Fourthly, with her consent, when the man knows that he is not her husband and that her consent has been taken because she believes that he is another man to whom she is or believes herself to be lawfully married. Fifthly, with her consent, when her consent has been obtained at the time of giving by reason of unsoundness of mind or by the reason of intoxication personally or through any other of stupefying substance, when she is unable to understand the nature and consequences of that to which she gives the consent. Sixthly, with or without her consent, when she is under 18 years of age. In old definition, it was 16 years of age, the age of consent. Seventh, when she is unable to communicate the consent. It is a new insertion after the new definition of rape. Now, few explanations are there and few exceptions are there. Explanation 1 is, in new definition of rape, vagina shall be included into the labia majora. Consent. Consent means it is a voluntary agreement when the woman by words, gestures or any form of verbal or non-verbal communication communicates willingness to participate in the specific sexual act. Preferably that a woman who has not physically resisted to the act of penetration shall not by the reason only of the fact but regarded as a consenting to the sexual activity. Now the exception, according to the 375 IPC, a medical procedure or intervention, it shall not constitute the rape. Sexual intercourse, second explanation is sexual intercourse or the act by a man with his own wife, the wife not being the under 15 years of age, is not rape. So these are the very important sections now which I am telling you because of the medical fraternity and the nursing professionals. According to the 357 IPC, 357 CRPC, all the hospitals, whether it is public or private, whether it is run by the central government or the state government or by the local bodies, it shall immediately provide the first aid or the medical treatment to the victim or the accused. That should be the free of cost, which is covered which can be covered under the sections 326A, that is throwing the acid on the person, 376A, B, C, D, E. These 376, they are the punishments for the rape, and shall they immediately inform to the police regarding the incident. So according to 166B IPC, whosoever being the in charge of the hospital, whether it is public, private, whether run by the central government or the state government, it must contravenes the provisions of section 357C of the CRPC, and they shall be punished with imprisonment for term, and they may extend to 1 year or with fine or both. Now what the section 164 CRPC explains, that examination should be, this is the main part of our presentation, examination that shall be conducted by the physician employed in a hospital run by the government or the local authority, the registered medical practitioner to whom such woman is sent. He should without delay examine her personally and prepare the report for his examination. and in the examination report the exact time of commencement and completion of the examination shall be noted. Now comes the examination of the rape survivors. How to overcome the and how to report the opinion, what are the evidences we should be collected along with the nursing professionals. So what is the responsibility of the medical fraternity? First, we have to collect the physical evidence as soon as possible to corroborate the charges of offences. We have to manage all the injuries. We have to give the first aid as soon as the victim or the rape survivor comes in the casualty or in the forensic medicine department. We have to prevent and give the treatment for if we find any vulnerable diseases like STD or gonorrhea or syphilis. And the survivor should be referred to the psychologist also for the counseling. Now, before the examination and before the collection of the samples, what are the prerequisites that we must be taken? First, we have to take the written request from the police. If the written request is court is there, then it will be preferable. Secondly, we have to take the informed consent of the victim. If the victim is below 12 years old, then the consent from the local guardian should be taken. We have to mention in the report what is the place for the examination, time of the examination, when we have started the examination, what is the end time of the examination, in presence of the female staff. That may be the nursing professional also. So in the examination part, we should include the proper history. As soon as the survivor comes, we have to take the proper history. We have to make the eye contact with her, and we have to be friendly with her. After that, we'll proceed for the general physical examination, in which we have to. I'll explain all the slides, all the topics in the further slides, and then we have to do the anogenital examination. After that, internal examination, then recovery of any physical evidence, then laboratory evaluations, any test for the venereal diseases, and the medical and the toxicological treatment. Now first comes the history. As soon as the survivor comes, we have to take down the medical history of any injury or any illness. We have to ask the survivor the time of incidence, when it was happened, or the post incident events in the detail. We have to take the detailed history. Also about the personal history, that like menstrual history, what is the last LMP, and the place where the incident has occurred, specific nature, whether weapons were used or not at the time of the incident, or any post incident events. So in the general physical examination, the survivor should be asked to stand on a white platform, or the white paper should be there, and the survivor is asked to stand on that and to undress herself one by one, so that all the evidence is collected. They are collected on the white paper, and we'll preserve them and hand it over to the investigating agency. So the whole body should be thoroughly inspected for any dirt, for any injuries, for any skin disease, or any old injuries, or it may be we have to examine whether it may be the self-inflicted or not. So all the injuries, they should be described in detail as per their shape, dimensions, color, whether it is scabbed or not, whether it is bleeding, swelling. All the injuries we have to taken briefly. So this is a diagram slide which is showing, we have to mention all the injuries on the diagram with all the dimensions. So any bite marks, they should be photographed. Any injuries, all the injuries, they should be photographed. What is the general patient, patient general appearance, whether whether the survivor is average built, heavy built, or nourishly. What is the condition of the emotional distress, or she is in depression or not. That's why we are referring them to the for the psychological counseling. We have to take the vital signs. We have to also examine the abdomen, whether there is abdominal injury or not. See, this photograph is showing the survivor having the injury on the left hand during the which she has got during the assault. So we have to photograph this injury. We have to mention the dimensions of these injuries on that photo on that diagrammatically. See, this is the contusion and the abrasion which are produced during the assault. Now after that we'll come to the anogenital examination. Before this examination, it is important to collect the samples from the female genital area. Initially, the external genitalia and the surrounding area, they are inspected first. So during the internal examination, the inspection of the vaginal opening, that is introitus, should be done. The injuries that are most commonly seen in these rape victim survivors, they are mostly seen on the posterior fourchette and fossa navicularis. The labia majora and minora, it may be seen that abrasion and bruises are found on that area. The hymen, it may be injured with it may be seen that bruises are there. After that, we'll proceed for the rectal examination. And then how to do the examination of the hymen. So hymen examination is used using the Glacier keen rods or globes. The injuries which can be produced over the hymen or which can be seen over the hymen, there may be abrasion, bruise, laceration, and there may be the swelling, which are seen mostly on the 5 o'clock position or the 7 o'clock position. So these are the differences we all know about the intact hymen or the ruptured hymen. That is situation of notches. They are in the intact hymen, they are present anteriorly. In ruptured hymen, they are present on the both sides. Size and shape in the intact hymen symmetrical on the both sides, but in the ruptured hymen it is asymmetrical. What is the cause of intact hymen? In natural, but in ruptured hymen it may be the sexual intercourse or maybe the insertion of the foreign body. Then we'll proceed for the examination of the vagina, whether there are injuries on the vagina, labia majora or not, laceration, there may be the bruise, there may be the contusion or abrasion, they may be there. Then the examination of the cervix, then we'll proceed for the colposcopy, then tolerated blue. So all the evidences which we have collected, they should be wrapped in a sealed envelope, and before the examination we'll proceed, we should worn the gloves and change after every sampling from the different parts of the body. For this, safe kit is also available, which is available in the gem also. Safe kit, this is the instruments which are showing in the safe kit. Gloves, this is a tube which we have to take the swabs and put it in the tube after the air dry. So after taking the samples, we have to label them like swabs of the seminal stains, swabs of the foreign body material on the body, swabs of the blood stains on the body, or the oral swabs. We have to mention, we have to label all the evidences and seal them properly. So these are the safe kit instruments like scissor, nail cutter, comb, syringe. This is the EDTA vial for the collection of the blood. So basically blood and the urine samples, they have to be taken in the sodium fluoride solution. Blood for DNA, they have to be taken in the EDTA, and the control samples should also be taken. So regarding the skin samples which we have to take, that areas with the deposition of the saliva or semen and bearing any injury marks, we have to take all the skin samples along with the control skin. For dried stains, we have to collect that dried stain according to the protocol, and we can examine the stains in the ultraviolet light, which in the previous class Dr. Abhilash has told already. So we have to take the skin samples from the web of the fingers like this. We have to take the swab along with the wet distilled water or the saline water and put it in the test tube after the air drying properly. Because of the recurrence of the fungus, we have to take the precautions. This is a method showing the stains on the body parts during the ultraviolet examination. So regarding the collection of the hair samples now, most commonly samples to detect the body fluids or retrieve foreign hair particles or hair follicles, they should be cut if they are matted. It may be found in the survivors that the genital hairs, they are matted due to the deposition of the semen or the saliva. So they should be cut. If we find any foreign particles or the hairs identified on the head or pubic hair, they should be collected with the forceps and then submitted for the analysis. The pubic hairs, they should be combed into an uncontaminated paper with the in the position of the semi-lithotomy. We have to collect in that position. Now the nails, how to collect the sample of the nails? Like trace materials like skin, body fluids, hairs, fibers and soil, they can be collected under the fingernails of both the victim and the assailant. Clipping of the whole fingernails, they should be taken. This is a procedure how to take the nail samples. Now the swab, how to take the swabs from the oral cavity. Firstly, we have to take the saliva sample. We have to take the 10 ml of the saliva. Then after that, rinse the mouth with 10 ml of distilled water and then again take the second sample for examination. This is the method how to take the swab from the oral cavity. Now the samples which we have already, which have to be taken from the female genital area, there may be any external sanitary napkins or the internal tampons that we have to be collect and sample and sealed and handed over to the investigating agency. 2 swabs that are then used to sample the vulva. 2 dry swabs are taken which are used to swab the lower vagina. Speculum of proper size lubricated with the sterile water is passed gently about 2/3 into the vagina, into the posterior fornix. They are called as the high vaginal swabs, and 2 cervical swabs and 2 urethral swabs we have to take. And aspiration of any fluid, we have to take 2 to 10 ml of the saline or sterile water into the vagina, and vaginal washings, they should be aspirated and collected. This is a method how to take the swabs, vaginal swabs. Now how to take the rectal and the anal swabs. In this, 2 swabs should be taken from the perianal area externally, and the anal canal is then sampled by using a wet swab and then a dry swab up to 3 centimeter into the anus. It should be taken. The proctoscope lubricated with the sterile water is then passed into 2 to 3 centimeter into the anal canal, and the sample is taken after that using a dry swab. So as I have already told, the sample should be collected and properly labeled with the name, age, sex, date and time of collection, name of the investigating agency with the police station, so that to establish the written documentation of the custody, proper chain evidence should be there. And lastly, we have to write the opinion like this, that there is evidence of recent sexual intercourse, or there is evidence of recent penetration, or there is no evidence of penetration but the possibility cannot be ruled out. We have to write the one opinion from all these 3 options. So lastly, we all from the medical fraternity should ensure that none of the victim of the rape should be denied justice in the court of law just because of lack of evidence is resulting from the badly conducted examination by the doctor. This is a take-home message from this presentation. Thank you so much.
Thank you so much, sir, for your detailed presentations on how to examine the survivor during when they come to visit to the hospital. And as you have said, sir, your session was very interesting and very informative. And I do agree with you that some of the nursing personnels are utilized less. Because whenever we see many nurses are there in the hospital, but in some specific area, like as you have said in the forensic, where you need the nurses, and some kind of the substance use disorder area also, nurses are underutilized. So we are looking forward to that. Once we have this kind of the courses in future, we'll having the proper utilization of the nurses. So I do agree with you.
Sorry to interrupt you. In my view, regarding the nursing professionals, it's my request that they should be the new trainees. They should be posted in the forensic department, in the mortuary and in the department when all the cases comes for the sexual assault survivors or the accused examination, so that the nursing staff, they should be trained. I think this is in my view. This is my request.
I think this request will be taken up by our principal ma'am, Dr. Lata ma'am. So we'll be looking forward to that. So thank you so much, sir. Ma'am, would you like to say something?
Audible?
Yes. Lata ma'am, would you like to say something?
Am I audible?
Yes, ma'am, we can hear you now.
Yes, ma'am.
Please go ahead.
Very interesting and practical session what Dr. Kulbhushan Prasad has taken. Nursing is mainly a procedure, a practice-based profession, and we have many procedures included in nursing. But forensic nursing procedures are definitely not learned by any of us, or it is not part of the curriculum. So we have to include the procedures, how to examine the accused, or how to examine the victims and collection of samples, evidences. I think practically we have to have the sessions and exposure for all the nursing students and faculty members. So it was very, very useful session for us, Dr. Kulbhushan, and probably we have to create videos now guiding the nurses how to perform the procedures related to forensic nursing practice. Thank you.
Okay, thank you, ma'am. Thank you, sir. Thank you so much. Without taking much time, I would like to call upon our next speaker, who is along with us now, Dr. Varun Chandran A. He is working as assistant professor in the Department of Forensic Medicine. He has completed his MBBS and MD at the Government Medical College, Kozhikode, Kerala. He completed his senior residency at Government Medical College, Kozhikode, Kerala, and AIIMS, New Delhi. After completion of his senior residency, he worked in the Center for the Advanced Research and Excellence in the Virtual Autopsy Project in the Department of Forensic Medicine and Toxicology, AIIMS, New Delhi, under the Dr. Sudhir K. Gupta, and he has been working as an assistant professor in the Department of Forensic Medicine since 2020. So I would like to request Dr. Varun Chandran to deliver his session on forensic evidence preservation in other medical legal cases, including trauma. Over to you, Dr. Varun.
Thank you, madam. I think I'm audible. Yeah. A very good morning for all my respected senior faculties and my colleagues and the respected organizers of this great function, great initiative, and moreover, all respected delegates of this conference, virtual conference. So directly, we are already late, so I'm directly going to my topic first. Today's topic is forensic evidence preservation in other medical legal cases, including trauma. That means sexual assault victim or similarly accused examination will be taken care by a few of my other colleagues. And so directly we can go to the topic first. So we should be aware of the we should be know some terminologies. What is evidence basically? Because especially physical evidence, now we are talking. Physical evidence is any object that can establish that a crime has been committed or can provide a link between a crime and its victim or a crime and its perpetrator. That means, for example, anything that can prove a crime. For example, blood of a victim on a knife. So if we can establish that a knife is present at the scene of crime and police seized it, and we can prove that the blood of the victim is absolutely present over the knife, means that is giving a relationship between the crime weapon and the victim. Similarly, bullet, we retrieved a bullet from the body, means if it's dead at the body. Otherwise, during surgery, if you retrieve a bullet from inside a person's body, means it is a very clear-cut, absolute proof that this bullet has hit this person. Whether it caused his death or some other health issues depends upon. And so similarly, the central dogma of criminal investigation involves the recognition, identification, comparison, individualization, and interpretation of evidence. Medical professionals, so we can come to our area. The medical professionals involved in dealing with medical legal cases have a lot to do with producing credible forensic evidence of any kind in trial court or any other relevant forum, legal forum, hence in the deliverance of justice. Means so not preserving necessary specimen as per the merit of the case can attract legal penalties. Similarly, improper preservation also will have to withstand legal scrutiny. Before going to the topic, exact topic, we have to know something more about chain of custody of an evidence, because it's very much important to prove an evidence in the court of law. So what is basically the chain of custody of an evidence? So chronological documentation of the actual possession of a piece of evidence from the time it was first identified until it is offered as a piece of evidence in the court. I think with examples you will get the concept clear. And this is an important thing to be aware of while preserving any medical legal evidence or sample. Each evidentiary material must show proper documentation of seizure or collection, custody, control, transfer, analysis, and final deposition at court. So the chain of custody verifies the actual possession of evidentiary point of time, and it ensures that at any stage the real evidence is not lost and any false evidence is not introduced. I am giving a hypothetical situation. It's a practical example in which one knife was found nearby a dead body, and the body was in a pool of blood with some injuries over the body. So in this kind of cases, how to maintain a proper chain of custody for this knife? I'm just explaining. From the scene of crime, the police has to take possession of the knife. So they'll be the first responders. They will be there at the scene of.
Okay, sorry for disturbing. Slides are not visible. Yes. Yes, now it is visible. I think you may have shown the previous slides also.
Small thumbnail. These slides I'm skipping. This is the first slide. So physical evidence. What is a physical evidence, and what is the importance of physical evidence? Then chain of custody. I think we have covered only up to here. So this is the schematic diagram. So one knife is found near the body. So police has to document it properly with seizure memo, and they will be documented in their case diary also. We have got this thing. We have sealed it in front of two witnesses, and they will send it for commonly directly they will send it for fingerprint expert of for FSL, Forensic Science Laboratory, for the first examination. After that, they will seal it. Police will seal it at the scene of crime itself at the time of seizure. Then they will note it down properly from where and in presence of whom they have stored it. After that, it will go to first expert, and in a sealed condition with a sample of seal of the investigating officer. Then they will open from FSL, Forensic Science Laboratory, this cover, and they will examine for fingerprints, and they will give a proper printed fingerprint report. Along with, they will seal it back. They will seal the knife back and give their sample seal and return it back to police. From the So all these things will be documented in the report and in the registers, and police will receive it, and that will be also entered in police case diary. And after that, it will go to the second expert, commonly serologist, because there may be biological stain over the knife, like blood stains or something. So it has to be examined, because the relation with the victim should be established without any reasonable doubt. So then in forensic science laboratory, another division, the serology division, they will examine, and they will also reopen. They will open the seal given by the fingerprint expert and cross check with the seal. Then they will document it, and they will open the cover and examine it and seal it back with their own office seal, with a sample seal, and it will be returned to police. Later, police will come to the autopsy surgeon who conducted the autopsy of this victim. Otherwise, if it is a survived case, they will come to the treated surgeon who examined the injury and ask whether this injury is, examine the weapon and to opine whether this injury is possible with this knife. So that also we will get it in a sealed envelope and the seal of the serologist, and along with the sample seal of the serologist. And so then after our examination, we will seal it back. We will give our sample of seal, and we will hand it over to the police, and after documentation, proper documentation, register and report, then we will give it back to police. Then the police will submit it to the court of law as a physical or material evidence. So 3 reports will be there, the knife will be there, many registers are there in the background. So at any point of time, for example, on 12th March 2021, we can clearly say there is an allegation, there can be an allegation come in future that on this day it was tampered. So who is responsible for that thing? So we can easily establish that thing. And so this is a simple example. We got a case. The knife was not in the scene of crime. It was inside the body, because unfortunately that was broken. And we preserved it. We measured it. We preserved it and sent it to the handed over to the police. Along with, we sealed it along with our sample seal. We handed over to the police. So the importance of documentation. documentation is very much important in case of maintaining chain of custody. So before that, I will show, means this is our sample seal, and this is how we are sealing some of our samples in our department. And in all of our postmortem reports, we even in clinical forensic medicine samples, we used to mention almost a sentence similar to this: all specimens are duly preserved, packed, labeled, signed, sealed, and handed over to the IO along with sample of seal, because it's important in the course of legal procedures. And this is another thing in a FDA paper: sealed DNA sample sealed in an envelope. So this is our register, one of our register, manual register. We are doing it digitally also, because for receival we are keeping a proper master manual register. So in that you can see ligature material is received, whatever specimens we are giving. So we will mention it in our report, and the receival of the involved police authority will be get it done in our manual master register of department. And this is another example, because in right side you can see that's a portion of one of our postmortem report. In that the doctor has clearly mentioned all these specimens: stomach, small intestine, liver, kidney, spleen, and other viscera as preserved, what is the preservative, and it is handed over to the police, and the receiving police official has signed and received it. After that, the same thing, the whatever thing and the thing we wanted to be examined at forensic science laboratory, they did it and they gave their opinion. And in their examination report, they have clearly mentioned it's only, I think it may not be readable. Then also I can say the entire 2-page opinion. In the 2-page report, the entire first page was dedicated for showing the proper chain of custody has been maintained, because it is written our sample seal is there. They have cross-checked with the sample seal, then only they have opened the sample seal was proper. So that is very important in court evidences, while giving court evidences. So we have to be aware of maintaining proper chain of custody wherever, from emergency, from operation theatre, from wherever we are preserving. We have to make it sure it is properly documented, and we have to keep in mind that it can go for legal scrutiny at any time. So we can directly go for preservation of evidence related to clinical forensic medicine. It's a voluminous topic. Lot of samples can be preserved, and so I'm going for the few salient points, some examples. So in poisoning cases, commonly routine body fluids, especially gastric lavage, vomitus, blood, urine. Other than that, some cases if possible, we can go for even saliva or sweat sample can be preserved, sealed, and handed over to the police from emergency department itself. And you have to get a proper receival in proper register. And so if there is vomitus or feces, soiled clothes, that can also be, we can air dry it, pack it, seal it, and hand over to the police. And in case of unsoiled clothes, especially if we are expecting some drug overdose or something, if possible, we can preserve it and send it. And proper documentation itself can be an evidence in court of law, because our register also can be called for the to the court to make it sure that whether we have given or whether police or any person in between has keep something extra or remove something. And many cases happen also in this regard. And specimen may be missed if the healthcare professional in the ED team are not aware of the importance of the preservation. That happens in many cases, even in poisoning, lot of gastric lavages, even homicidal intention poisoning may also, we may not be able to get the exact nature of poisoning, because this is the crucial evidence. Because after 5 or 10 days in ventilator, the patient died, means we are not going to get any proof of the material what he has ingested. So if emergency department can preserve the gastric lavage or blood at that time, it will be very useful for the justice delivery system. And in case of acute intoxication, blood sample for alcohol can be collected, and so oxalate and sodium fluoride will be the better preservatives. And blood, urine samples for other intoxicants and drugs can be collected. I'm coming for the preservatives later. And in case of an arrested person, we can keep it in mind always. In case of an arrested person, section 53 of CRPC permits medical examination even with the use of reasonable force. So I think other than poisoning, in emergency departments where our nursing force is more exposed to forensic cases, the second or even most common case is assault cases of variant degree and different causes. So in that kind of cases, collection and preservation of specimens or evidence from a victim of an assault should not be made without consent. They have their right to deny. We have to give the treatment, that is primary part, but whether we have to collect it or whether we have to transmit it for further examination in forensic science laboratory, that will directly go only with their consent. But if the subject is an arrested accused of a criminal offense, specimen or evidence may be collected even though the accused is not giving a consent by using reasonable force. It is not exactly defined in the law, but a lot of interpretations are there. Interested people can go and read more about this thing. And another thing is, another area is because ED people, emergency department people are getting very clear cut, in assault cases, very clear cut view of the first view of the injuries. So if we can document it photographically, because after 1 week the person may die and reach to the mortuary, and we may not be able to appreciate the type of injury even. It will be healed, surgically altered, but at the time of entry, at the time of first contact with the medical system, if we can take photograph, and that is the best for the low justice delivery, but it may not be practical, we all know. This is actually in AIIMS trauma cases in our trauma center. In medical legal certificate itself, they are incorporating photographs of the injuries. And other than that, there is no exact clarity. That is also mainly because of forensic nursing facility is not well established. So no one knows even who has to take photograph, because commonly treating surgeons will be seeing the cases. Who has to take the photograph, how to preserve it, whether it has to be handed over to the police in soft copy or printed format. Lot of confusions are there. So if you people enter into the field properly, then we can sort it out, this kind of issues, and we can make our assault examination more scientific and more productive. And in assault cases, clothes examination is important. Preservation is also important, because there will be blood stains, because arterial cut it will be giving some different kind of patterns, pattern, venous cut that will be something different. If the blood stain came from the accused itself due to some defensive injuries, that will be very much useful in the further investigation and all. And cuts, tears, soiling, burning, etc. may be correlated with the injury, so it has to be properly preserved. And in all cases, almost all biological samples in dry condition, if you are planning to send, always make sure that it is properly air dried, because otherwise it will get molds, fungal growth will be there, and further DNA analysis or most of the analysis will not be feasible. In this specimen, simply we are keeping a blood-soaked shirt inside a cover. We will feel that, okay, I have kept the specimen or evidence, but it won't be of any use if it is not properly air dried. So in emergencies, we can make there are a lot of equipments are there for drying this kind of clothes and other evidence. So that's also needs some dedicated person to take care of the machine, but nowadays it's not in practice commonly in India. And after drying, inner paper covering is advised. And foreign bodies, in case of foreign bodies, because splinter of broken glasses, piece of road, broken portion of a possible weapon like that of a knife or firearm bullet inside, means just outside the cloth or something, means during the external examination, you will be getting lot of foreign bodies from the body. And commonly in our emergencies, that will be thrown. So if you can preserve it, even you can prove, that will be the only possible evidence that connect the accused or the weapon. Accused weapon, that means commonly the accused person, and the crime. So we are losing lot of evidences from our emergency departments because of lack of trained people, forensically trained people. Means we are doing our job, but we are missing lot because of our ignorance in this field. And weapon of offense may be there present inside in the body itself. Some cases you might have seen half pierced knife and all. So we can remove it in theater or in emergency, and so we have to examine it. We have to note it down properly, document it, pack it, seal it, and hand over to the police on receipt. And in assault cases, DNA examination, I think already Abhishek sir has clearly covered, and FTA papers are ideal, but I think most of our facility, most of our the delegates may not be getting access to this thing because it's a little bit costly, but we can collect it in EDTA vial or otherwise dried blood in proper sterile gauze will also work for the purpose. And assault cases, different swabs may be needed depending upon the merit of the case. If you're going for case to case, it will be taking that much time. So, and fingernail clipping or scraping can be preserved in assault cases for detection of foreign DNA. And blood samples for drugs or intoxicant drugs can be taken because we may not be knowing whether that person is incapacitated then assaulted. So the case will come in future. So keeping all this in mind, we have to holistically approach a case and take all possible evidences. And in case of hit and run accident, hit and run means a person has one vehicle has hit and the driver didn't stop and he flee from the scene of crime. Or in other case of road accidents, sometimes if we will be getting some glass pieces over the clothes or paint flakes of the vehicle on the clothes of impact site. So these all things are very much important in for forensic point of view. We will be seeing that things, some yellow things. So if we can preserve it and in future the person may die also, or in insurance claims may also. Otherwise police is not identifying most of the vehicles in hit and run accidents. Now CCTV came and we are getting some more cases proven, but if you can preserve that paint flakes or glass, so it will be very much useful to identify or spot the vehicle. And so in mortuary we are doing it, but in emergency we are missing a lot of clothes because you have to examine, you have to change it into hospital clothes, so the things will be given to bystanders or relatives, they will throw it. That is what commonly happening. So we can avoid that and we can preserve it and we can send it. And scale photographs are very much important because especially if there is proper tire mark, after 1 week it won't be visible. So if you can take proper scale photograph, it will be very much useful to correlate with the accused vehicle, because heavy vehicle and a car tire marks will be entirely different. So proper scale photograph can even prove a crime. Then state of intoxication of in RTA, especially in case of driver, we have to preserve blood sample. Because in as per Indian law means 30 milligram, less than 30 milligram of deciliter alcohol is allowed, but more than 30 means that is a crime. So it will have impact on the in case future. Then another case commonly comes in our EDs are gunshot cases, especially in Delhi we are getting lot of cases. And preservation is cloth is very much important because in close range shot the discharge of firearm will be present over the cloth. It will be useful to fix the criminality, who did the crime. And if possible swabs and scale photographs can be taken, but we all know it may not be easy to take photograph because our primary care is always to treat the patient. But if possible, if a forensic nurse is dedicated, forensic nurse is there, means at least in between, if time if they can find time, they can get it done. It will be of very use for the court of law in future investigation. And in contact or close range firing, swabs can be taken, but may not be practically possible in all cases. And proper documentation of injury is mandatory because documentation of therapeutic alteration is also mandatory, especially if you refer or you will be knowing John F. Kennedy's case, because neck mein there was a gunshot injury and they converted it into tracheostome, and then the autopsy surgeon got confused, means that will produce confusion. So proper documentation of injury and therapeutic alterations in the theatre staff nurse, if he is properly aware of the forensic implications of this, nursing note may if it is put or surgeon's note may if it is there, it will be useful for the people who are following up the case medico-legally, like us in mortuary. And treating team is supposed to give a clarity towards the range of firing to the court of law, where the victim surveys a considerable duration. Because in a complete sepsis case with some sutured thing, we are getting in mortuary, means it's not possible, practically it may not be possible to identify or give the court who fired or at what distance the firing happened. It may not be possible, but the clinical forensic medicine emergency team, especially with the help of a forensically trained person, can deal this issue. And in gunshot case suspected, people also can be brought to the hospital because it's also important whether he has fired or not. So in normal gunshot cases, there will be a huge gas discharge and it will be deposited at hand. The third one is the UV examination of hand. Some fluorescence will be there. If this all dust means unburned or partially burned powder or soot particles are deposited. So we have to collect it. Gunshot residue in trauma center people means in many hospital staff nurses who are working in ED will be knowing it. So it will be brought. So this is the area from where we have to collect. Commonly, this is the area where this dust will be deposited. So from here, from both hand, we have to collect. And then we are commonly using swabs because that is the only available thing in our system. But many other things are there to preserve. So if proper educated or proper formally trained people are there to collect this thing, we can even try to implement Western standard sample collection techniques in our system. And in neck compression of neck by ligature, many cases comes as in coma stage due to cerebral ischemia, that they die due to hypoxic ischemic encephalopathy. So they will be in ventilator for many days, and in that kind of cases we will be getting a proper hospital acquired pneumonia cases with a scarred injury here at mortuary. So in this kind of cases in emergency department, if I'm not saying if you people means if the people who are taking care of the patient, the first respondent can save something for the low legal delivery system or low justice delivery system, that will be useful. Especially we can remove the fibers because we can go for Locard's principle. Every contact leaves a trace. That is an established fact, and especially in criminology. And with contact between two items, there will be an exchange. So whether we can find it out or not is the issue. So we can lift it, strip them off, means there will be some fibers at least, especially in ligature strangulation. So we can use a normal cellophane tape, say we can lift it and paste it over a glass slide, and you send it for the forensic, hand over the police with proper documentation and receipt. That will work that will serve the purpose. And another confusion is actually in case of medical termination of pregnancy, the product of conceptus will be there, so we have to preserve it, and we have, especially in disputed cases, if this is a survival of sexual assault, penetrative sexual assault, or in case of if there is any disputed paternity, we have to preserve it and send it for DNA analysis. DNA analysis ke liye frozen samples are allowed, but it's not feasible in our system, so we can go for sodium chloride crystals or saturated super saturated sodium chloride will work the purpose. Never keep it in formalin because DNA analysis is not that much yielding. The proper DNA will not be available. It's technically difficult. And other specimen from EDs, blood sample for civil matters, disputed maternity, paternity, we have to, anyway, in any cases of DNA sample collection, whatever fluid is there, we should be having almost taking proper sterile precautions, because that is that much specific test, and the sensitivity is also very high, so we should not contaminate our sample. Especially for DNA matching, we have to be that much careful. And sexual accused and victim examination will be covered by Kulbhushan sir, and accused examination will be covered later today. So I'm not going for the sexual offense part. And in case of, there are a lot of other cases coming to emergency departments, domestic violence, intimate partner violence, battered babies, neglected old age people. So in all these cases, photography, injury pattern, because if a trained person is there who knows about injuries, because surgeons or clinicians who are practicing in emergency department may not be able to spot it actually. But in forensically trained, I can spot it easily, and they can inform the doctor if forensic doctors may not be available, because commonly we stays in department and mortuary means autopsy related work. In some cases we are called for clarification or consultation, but in all cases we may not be there. So if a forensically trained nursing staff is present at emergency department, we can preserve a lot of specimens. And we have our own forensic clinical forensic unit in our department, and this is our manual register in which we are keeping all these things. And for the sake of keeping confidentiality, I mask most of the thing. You can see the headings, department number, date, MLC number, and name of the accused or whoever. And the thing is actually what is the examination we have conducted, and what all samples we have preserved. So then after that there will be receipt of the concerned police official. So this is our maintaining of this is the beginning point of chain of custody in this case. After that, that person is responsible for depositing it into the FSL, and they will be responsible for giving an opinion. So from this area is not exactly covered in previous sessions, because this is our mortuary in AIIMS New Delhi dissection room. And so actually in forensic nursing all covered regarding the utilization of forensically trained nurses in clinical forensic medicine. But there are a lot of scope in job in our mortuary setup also, because there is some salient features. There is no time restraint. You can collect your samples with your time, and consent is not needed, because this is state property, means body is under the custody of police. They are handing over to us, so we can preserve whatever sample we feel needed for the need of the case. Generally, we used to preserve as per the requisition of the investigating officer. Doctor can decide as per the merit of the case, even though the IO has not requested. If we feel there is a possibility of potential evidence, we can preserve it. Then forensic medicine, commonly forensic department sample collections and preservation goes in a proper way, because we are to an extent we are trained regarding this thing. And viscera preservation for toxicological analysis is the most this is the commonest specimen from all forensic medicine and toxicology units towards FSL. And we have to preserve in lot of different cases. I'm giving enlisting some number of cases, whoever the IO request. Otherwise, history of suspicion of intoxication or poisoning, RTA cases, especially in case of driver who died within 1 or 2 days of accident, because we can get an idea of whether he was under influence of alcohol or any other drug at the time of making accident. And cause of death after complete, there is no cause of death even after complete dissection, then we will be forced to keep viscera to rule out any poisoning. Workplace accidents, and so because in state of future compensation in civil litigation, it may be needed to prove that the person was not under the influence of alcohol, egg lift fell during workplace or whatever. So it may be useful for the family members of the decedent also. And the history of drug abuse, alcoholism. In a lot of cases we are preserving viscera, and this is the postmortem requisition form. You can see on the left side the police has to tick whether they need proper routine viscera. Other samples are blood in clothes, or in case of any other specimen, if they need any evidence collection needed, they will be specifically right. And even without their request, if we feel that, we used to keep it. And these are our labels for our specimen preservation for viscera, which is used in AIIMS mortuary. And so normally in normal viscera, we used to keep stomach with contents, because most of the poisons are taken orally and temporarily stored in the stomach for some duration. So that is the first storage point. Second thing is small intestine with contents, because to detect the poison has transited the pylorus. Kab hua, when did he take? Whether it is spontaneous or whether some time passed after having that orally having that poison. Liver we used to keep with some portion of gallbladder, because liver is the main detoxicating unit in our body, so many toxins can concentrate in liver, so we keep liver portion. And kidney, because it's the main excretory organ, so we may get some toxic principles or their breakdown products from sample of kidney. Then blood sample we used to preserve, and urine sample also, because blood is a proof of absorption, means anti-mortem poisoning, and urine also obviously a proof of absorption and excretion. So then, as per the need of the case, we may preserve even brain, lung, or whatever portion depending upon the nature. Even nail hairs for arsenic, means in many cases depending upon the case we used to preserve different viscera for analysis. And commonly its ideal thing is called as rectified spirit. So previously it was used very commonly, and it's very costly. So now almost all over India, in most of the cases, we are using saturated solution of common salt. And even rectified spirit can be used for some specific chemicals, especially because which is having some reaction with this saturated solute. And blood sodium fluoride, potassium oxalate, and combination will be better. Sodium fluoride is actually for means enzymatic activity to stop enzymatic activity, which can produce some extra increment of alcohol in blood. And potassium oxalate is as thinner. And urine saturated solution of sodium chloride, rectified spirit, thymol, sodium fluoride, anything can work. Even normal urine also people used to send. It will give a result. And note that formalin should not never be used for chemical examination, because if you keep the specimen in formalin, and it will produce the extraction process in chemical lab very difficult, and we may not be getting proper result. And all the samples preserved should be sent separately and to rule out contamination. Okay, samples of preservative means a control sample also has to be sent to rule out contamination of the preservative. And in case of neck, we have already discussed that thing. Fibers can be taken from mortuary also, especially if it is a broaded cases, we used to take it. Otherwise, in case of treated cases and nurses or who are formally trained in forensic nursing can take this thing. And case of neck, because ligature material and knot pattern is very much important. So we have to preserve it properly. Preservation techniques are there. And in gunshot cases, we can see this is actually a suicide case, because you can see the hard palate mein entry wound. And in this context, this photo is not that much clear in the wound. There is soot staining, so it will give us a clear-cut idea about the range of firing. It's a contact shot, and the track was having soot. So in this kind of cases, bullets or fragment and blood sample for DNA profiling and fingernail clipping for foreign DNA, all these things can be done. These are some bullets we get, means we routinely get bullets from body, and so we have to preserve it properly. Preservation techniques are there, because each and every mark over the bullet is having some relevance to identifying the gun. So we have to do soft dissection. We should not use sharp weapons, sharp instruments. So we cannot touch with sharp instruments. So it is applicable for theater, means nursing staff and surgeons who is operating on a bullet victim and removing it. So, and another common case is bodies recovered from water collection. So we have to prove that the person has died in this water, because there are a lot of other possibilities: postmortem immersion, otherwise submersion in other place and throwing body in some other place. Lot of possibilities are there. So to make sure the person has died in that specific collection of water, we used to collect sternum, and we used to keep it in crystal salt or formalin to detect diatoms. I'm not going for the theory of diatoms. And we have to advise, along with that, we have to advise the investigating officer to collect a specimen from the alleged scene of drowning and for comparison under microscope in forensic science laboratory. So sexual offense, I'm skipping this slide almost, because we have discussed all these things, and accused examination will be dealt by Dr. Venkatesh also. So even in mortuary, we may be getting rape, murder cases, and that kind of that much heinous crimes may directly end up in mortuary. So we also have to collect all these specimens from mortuary. And a lot of other scenarios are the injuries by sharp weapon, injury by blunt weapon, RTAs, train hits, workplace accident, unidentified bodies, mainly in the orientation of identification, establishing the identity of the person, examination and preservation of clothes, hair samples, cut samples, plucked samples. Means I think Abhishek sir has described a little bit about means importance of root of hair in DNA analysis and all. So lot of scenarios are there in which we will be needing and help of a trained forensic nurse, and you can contribute a lot in all these sections which I explained. And in mass disaster, it's not that much common, but a multidisciplinary team is mandatory to deal with the situation and duties. And in that team, if there is a forensic, one or more forensic nurses are present, it will be of that much use for the team. Obviously, we know it. We have a lot of experience all around the world, and so duties and responsibility can be redistributed. Now we may be having our own protocols as per the current available trained professionals. We have to think about changing it also when we started getting trained nurses in our field. And possible specimens and importance, I'm not going that much detail. And in identity, Milo sir and Abhishek sir has already told, because in tsunami or in even now in Ukraine war, lot of bodies will be there and their relatives will come later. So we cannot keep it for a long time. So we have to bury it. So how to detect and give them back the body remains even after 1 or 2 years. So there are techniques, and forensic nurses are involved all around the world in these kind of issues. So in case of mass disaster and a crime scene team, in crime scene visit also one person from medical and forensic background, combined medical and forensic background, can do a lot of work, do a lot of service to the society. And for that also it's a multidisciplinary team. We have to understand the roles and responsibilities. We have to redefine if new people enter into this field. And this is one case in which the High Court said that, means in this case there was a rape victim, rape murder case, alleged rape murder case. One person was even convicted for rape and murdering that girl. Even after conviction, after 10 years, in an appeal, High Court said that there was lot of loopholes in this DNA analysis. In this case, the semen DNA of the accused was found inside the vagina. Then also there were a lot of loopholes, means the court observed that even in these kind of cases, there is chance of manipulation. So that is the importance of keeping chain of custody to avoid the responsibility from our side. So forensic nursing and evidence preservation in clinical forensic medicine, current scenario, lack of formally trained or formally trained healthcare professional at EDs to deal with medico-legal evidence preservation. It's a fact. Now it's almost all over India. I think there is no formally trained healthcare professional, especially forensic nurse, in EDs to deal these kind of situations. And awareness of importance of proper record keeping and steps to maintain chain of custody is relatively, it is there, is going, and we all are doing proper job. We are doing our job well, but it can be improvised very much. And lack of dedicated workforce in the orientation forensic point of view is very less. And in clinical forensic medicine units, forensic doctors are the only formally trained personnel in this field, and other clerical staff or sanitary workers they are helping us very much, and they used to learn from experience and may not be aware of the exact gravity of the legal importance of the involved work. And medical legal record keeping and digitalization, I'm saying forensic nurses can contribute to all these fields. So directly they can contribute to all these fields. They can replace many people, means they can improvise each and every step that I mentioned in this slide. Medical legal record keeping and digitalization of records, properly trained educated staff nurse can improvise this area, and nurses trained in the field of forensic nursing will be beneficial to improve the current standard of medical legal system in our country. That is obvious. And the routine mortuary services may forensic nurses can help the forensic surgeon in dissection techniques, because I have seen postgraduate MSc nursing curriculum also shows they should have proper exposure to autopsy practices, and it can involve in specimen collection, preservation, packing, sealing and documentation, and in medical legal record keeping and digitalization of medical legal record keeping, monitoring of hygiene of mortuary complex, obviously. And moreover, with your empathetic approach, we can console the mourning relatives also, means lot of and in specimen preservation, many institutions and many governments, state governments are giving different rules are there. So if you are confused, even international standards are also there. If simple Google search will give you that much of a plethora of knowledge about how to preserve and what is the importance of preservation and all. I'm giving only very few examples. And thank you. And for this thing in evidence preservation, if you are formally trained and entering into our field, means in the field of forensic medicine, in the forensic practice, we have to learn a lot, and I think your training schedule, proposed training schedules, will help us. And for any other further help, you can contact forensic medicine departments, attached forensic medicine department for further training. Thank you.
Thank you so much, Dr. Varun, for such a detailed presentations and taking us, all of us, to that and highlighting what are the scopes and forensic nurse can work in future if it is coming up, and it will be responsible for all of us to make sure that it happens in India very soon. Thank you so much once again. And Sweta, do we have some questions that we can take up now?
Yes,
If you're
ma'am.
not busy.
We have some
Okay.
questions for sir.
Before that, ma'am, Lata ma'am, would you like to say something, or should we take up the question first or later? Ma'am? Ma'am, can you hear me? Okay, till we wait for the ma'am. Sweta, can we take up the questions? Can you please read out the first question?
Yes, ma'am. So the first question is, how many scale photographs should be taken?
Actually, some international forensic scales are there, wound examination scales are there, so we can keep it beside, but it may not be available in all emergencies. For that, we can keep tape or measuring scale nearby, centimeter and inch wala scale nearby, and if possible, we can even procure that thing. Forensic injury measurement scales are there. It is having some different color codes also, so we can even compare the color of the injury in future. It's available, but in market, but it may not be available in all emergencies.
Thank you, sir. So then, in strangulation, what will be the location of mark?
Okay, strangulation basic definition is actually compression of neck by means ligature. So commonly, if you are asking normal theory hai to in ligature strangulation, we are expecting one ligature mark almost below, at the level of below the level of Adam's apple. In ligature strangulation, commonly if the assailant is at the height of the same height of the victim, but it can change, it can vary, but you have to anticipate it anywhere around the neck.
Thank you, sir, for clarifying this question. Then, what is the role of nurse when she is examining a gunshot? Kindly explain. Is a nurse in forensic department permitted to examine the gunshot wound and document it?
Currently, our department, emergency departments are having staff nurses. They will be taking care of the injury portion and treating portion. And documentation is nowadays commonly done by the practicing doctor, that properly in these kind of cases, commonly surgeons or neurosurgeons who is taking care, means in emergency. So commonly now at emergency department, wound documentation may not be proper. I was giving a hypothetical situation, because in case for now in India, I think in any of the EDs are not having forensic nurses. And if people enter into the profession and properly formally trained people come into a formally designated post, then we have to think about redefining the role. Then we can think about it. Now at present, we have to work, means we cannot change overnight and by a discussion. So the system in every hospital or institutions are different. So directly examination and signing a wound report is not feasible, or it's not practiced in India now by a staff nurse. Wound certifications are being given by doctors nowadays, but if proper nursing staff who are involved, means knows exactly studied about the nature of injuries, type of injuries, age of injuries. So if they confident people who can document it, it will be very useful. A combined report or means combinedly signed reports may come in future, because the things are changing in your field also. I guess I answered the question.
Yes, sir. So thank you so much. And sir, in this addition to this, only someone has asked, so in case of gunshot cases, shall we understand whether it is suicide or homicide by analyzing the injury?
In many cases, it's possible. For example, I can give, because that depends upon the circumstance also, because commonly in right chin, means right-handed person, no one can shoot from back. Okay, means there are a lot of logic and a range of firing, because the accusation may be that person shoot from the next building, but here clear-cut soot stains are here, means range of firing and direction of firing and the site of selection of shot and a lot of things matters. While comparing all, if the person is properly organized, know about the fact of the case, in many cases we can clearly say whether it is suicidal or homicidal to an extent. Even anyway, we will send the cloth and swabs and all to the forensic science laboratory. We will incorporate their report also, then commonly before giving the final opinion in this kind of manner of causation of gunshot injuries.
Sweta, do we have any other questions? If it is
Yes,
not,
sir. Thank you so much, sir, for that elaborative discussion. The last question again we have, in MLC cases, how many years can we preserve the sample, sir? This is the last one, sir.
In MLC cases, our thing is we preserve it and immediately hand over to the police. Means we don't want to preserve the samples in our hospital. Means if it's an MLC case, preserve it and directly hand it over to the police and get the receipt. Then they have to submit it as early as possible to the forensic science laboratory if the merit of the case needs, if the IO wishes it. So better don't keep this specimen in our emergency department storerooms or something. You preserve it and intimate the police when they come. FIR load means you hand over to the police with receipt.
Thank you, sir. Sir, I think there's a flood of questions. Ma'am, can we take one more question?
Yes, yes, we can. There was a question why. I think previously also we haven't answered few questions.
Yes, ma'am.
That also you can.
Okay, ma'am.
Okay.
Sir, which
to wait
water
for some
sample
time.
is most appropriate in case of drowning, abdominal or lung water?
Last portion of the question means I heard that means which sample is appropriate for drowning, and
Yes, sir.
and water is not that much important. That is a finding. Our concept is if the water entered into the lungs and after that also the heart beats, okay, that the water can enter into the bloodstream, and there are some unicellular organisms, silicaceous material with silicaceous cell wall. They are known as diatoms. So that will be pumped, means immediately after a breath. After that also, if the heart beats for few more times, we are expected these things be present in very remote bony areas, means all over the part of the body. So if we can identify that thing from some sternum bone, then we are considering it as an absolute proof. There are controversies with that, but anyway, we are not preserving water from stomach for detection of diatom, but in case of suspected poisoning, we can preserve the stomach for chemical examination. To proving drowning, commonly it's possible, means even in case of post-mortem immersion in water, you can get water of the same medium from lungs, means in airway, or from GIT. Passive immersion of dead body can also result the same. So we are examining bony tissues for detection of ante-mortem immersion, means proper drowning.
Thank you, sir. So then where is the knot in case of real hanging or false hanging in case of suicide?
Knot can be anywhere all around the neck. It is that much variable, and post-mortem suspension commonly that also varies, means based on the knot position. Better, I think it's not better to comment regarding the manner, means whether it is homicidal or post-mortem suspension and all, because if we tie it here means it will be at front, and if we tie it here means it will be at the back. Practically all are possible, so we cannot generalize that thing as per my experience.
Okay, sir. So then previously in the session we had a question whether POSCO has provision to unfold the case of insane, dumb and deaf which won't be reported.
I didn't get the meaning of the question exactly. Dumb and deaf, whether POSCO have the provision to?
Has provision to unfold the cases of insane, dumb and deaf which won't be reported.
No, means it has to be come in light by some means. Means nowadays in schools also, students are having some kind of formal sexual education, and they are going through, girls, especially girls, I think both sexes are going through a lot of normal counseling, more means mental health checkup. So in that sessions, if they reveal, then it come to light. Otherwise, lot of crimes are hidden. And if they cannot report up to any of the care or one-stop center or any of the hospital, it may not be reported. Means there are a lot of cases which are not reported, which are not being reported only because of the lack of accessibility and lack of awareness.
Yes. So that was very elaborative, sir. So then what does control sample means in case of sexual assault?
If you are taking a swab, the basic concept of control swab is actually means we are collecting some specimen by using one swab or some cotton gauze or something. So we may be using some additive to that, means normal saline or something. So that can be contaminated. So the same thing means if we are using a sodium chloride means normal saline so swab for collection, you keep the same thing without collection, directly without collection as a control swab. So in that also, dono mein, if we are, especially it's if you are getting some chemical in one, then you have to cross check it first whether the same thing. If you are getting, for example, I'm not giving sexual assault context. Otherwise, in toxicology, we are getting an unexpected organophosphate in a case, and the water may be contaminated with organophosphate. And drinking waters also nowadays, nearby cultivation land and all are contaminated with a very minute amount of organophosphate. So it can be present in the control water also. So you can rule out the possibilities. It happened in one of the film actors' case. Chemical came positive, and there was some controversies regarding this. Control is just to make it sure that our specimen collection is proper.
That's it. Okay, sir. In case of slow poison, how can we know it, sir?
Depends. Slow poisons, you can give many things. Some cases only by clinical presentation. Some poisons are actually getting sedimented, or means some fat soluble poisons, even slow, we can detect it from fatty tissues. Some poisons like arsenic, the organochlorines are a typical example, like our furidine and all. Means slow poison can give it clearly even in adipose tissue examination, fat tissue examination, even in liver. And in case of arsenic like poisoning, that can be even deposited in bone, nails, hairs and all. So we are expecting, if you are expecting some specific chronic poisoning, by even in thallium, means that can be deposited in bony tissues and all. So if you are suspecting some specific poisoning of chronic specific poisoning, then we can think about the mechanism of storage, mechanism of storage in body, especially in long term, and you can go for it, and you can preserve the specific samples. That is what I mentioned. In some cases, we used to keep some specific samples, and we can send it. If that get it positive, that will be having some evidential value in court of law. It has to be corroborated with the clinical evidences also in chronic poisoning. It's not that much easy to prove anyway.
Yeah, sir. So that was very clarifying, sir. So then, how do you air dry samples without contamination?
That is a difficult procedure especially in mortuary setup. We have some stands, but there are air dryer machines and chambers are available, lock and key. We have some area for drying, and but in busy emergency departments, even though I told that we have to dry it and send it, practically we all know we don't be having safe places to dry it and safely dry it without any contamination, especially in DNA, is important. So it is a practical difficulty. Infrastructural difficulties are there all over. So there are provisions. Proper air drying mechanisms are invented in foreign countries. It has been in use in some means some institute. It is being in practice, but it may not be feasible for everyone to procure that thing at the as per the current status. That is why if trained people are working in emergency who are aware, if they can give the suggestions, then the procurement won't be difficult.
So then, sir, it is written in one of the slide, for some sample formalin, as it is a chemical, is not used. But COGS and entomological evidence are kept in formalin solution. Why is it so, sir?
Toxicology specimens. Formalin is a very good tissue preservative. Our main thing is we have to avoid decomposition. So formalin is a very good tissue preservative. We are using it for tissue preservation for histopathology examination, because entire cellular architecture will be properly preserved. So we can cut it and we can enlarge and stain it and enlarge and see it under microscope. That is an entirely different thing. But for chemical preservation, because the techniques used and the nature of most of the chemicals commonly seen in suicidal poisoning, the extraction method of chemicals at the forensic science laboratory is may be hindered by the tissue fixation and hardening of the formalin fixation. Means it's technical. Better for chemical, for histopathological or museum specimen, you can go for formalin or lot of solutions are the Kieserling solutions and all. These are formalin related, means tissue preservation for proper visualization, and chemical preservation is something different. We have to more than tissues, the most important thing is the toxins which we want to see and its extraction. So I think spirit or hypersaturated solution, sodium chloride solution will be better, and it's very cheap also. That is why we are opting for the common salt.
That's also thank you. So then we have two questions similar to each other, like can we take sample in plastic bags, and whether embalming affect forensic investigation?
Yes.
Clothes and all means.
Shweta, I think after this question we will start the next session. No?
Yes, ma'am. Yes, sir.
After this question we will start with next session, and after that we can take the question finally, I think. No? Okay.
Sure, ma'am. Noted, ma'am.
Paper bags means you can cover it means outside by plastic cover, because if you are expecting water means contamination and all. But even in all dry, even after drying, one layer of paper bag is advisable. It can absorb even some minute moisture or something. If it is something remaining, it can absorb.
Yes, sir. So thank you so much. We have comments like very informative and interesting session, sir. Thank you so much for clarifying all the questions, sir. Over to you, ma'am.
Okay, thank you, Shweta, for taking up the questions, and thank you, Dr. Varun, for clarifying so many questions for our participants. Thank you so much. Now, I would like to call up and invite our next speaker, Dr. Venkatesh J. He is right now working as a senior resident in the AIIMS in the Department of Forensic Medicine since 2019, and he completed his MD from JIPMER in the year 2019 and cleared the DNB exam in the 2020, and he had been awarded as Best Faculty Oral Presentation Award for the first prize in Reformation and Advancement in the Forensic Medicine and Toxicology Conference and in the Puducherry, and he published many papers and case report in national and international journals. He was also a resource person in the conferences. Now I'd like to request Dr. Venkatesh J to deliver the session on forensic examination of the accused in the sexual offences. Over to you, Dr. Venkatesh.
Am I audible? The slides are visualizing?
So slides are not visible yet. You're audible, sir.
Yes. Before starting my presentation, I thank to my HOD sir, Dr. Sudhir Kumar Gupta, giving a wonderful opportunity to present regarding the forensic nursing. And I also thank Dr. Kulbhushan Prasad sir and Dr. Abhishek sir for proper guiding for this program. And I'm very thankful to the organizing nursing team for conducting the short-term course in relation to the forensic nursing. And I also think that it will be a more useful and creating awareness among these forensic nursing among the faculty members of nursing across the country. So today I'm going to present on a topic forensic examination of accused in sexual offense cases. So this presentation based upon the what routine activity we are doing in the Department of Forensic Medicine in AIIMS New Delhi. I just want to convey what is the role, especially with the forensic nursing role in future. I want to discuss in this presentation. Coming to that next slide, I am going to discuss on the topic what is the necessity of the forensic nursing and what is the role of forensic nursing in accused examination. And before starting the examination, what is the necessary, what is the requirement for doing the examination, and how to assess the case during the forensic examination along with the forensic physician, and what are the samples required to be preserved. That is very two different cases. And you must know about how to draft the report also, so that you will be aware what the things going on, especially with the sexual offense examination. Coming to that necessity of forensic nursing, that in many places, especially in primary health center and the rural area, the forensic physicians may not be readily available for dealing these type of sexual offense cases, and waiting for an expert or referring cases to higher center, leading to the loss of valuable time for collecting evidences. So if that particularly trained members, especially with the nursing and assistant are available, can be provided, so that that should be that loss of evidence should be avoided, so that in that point of view there will be inclusion of forensic nursing in the curriculum in the undergraduate and in the postgraduate curriculum, that will give some part in imparting justice to the victim, so that they will aware of what is the role of forensic nursing in dealing the medico legal cases. They must be aware. Coming to that next slide, the role of forensic nursing. Coming to our topic of accused examination of sexual offences. In that, forensic nurse have the role must be aware of medico-legal cases. And next role is assisting the medico-legal examination and assisting for the collecting of evidences. So coming to the aware of medical legal cases, particularly for accused examination, whenever it is taken by the police, we must note it down the allegation, what alleged history of the case, particularly related to the sexual assault. And we must ask about the incident on which date and time. Particularly, this is very important for the collection of important. If it is a fresh case, that is at the time of incident, and same that way the accused was catched and taking him for examination, so we have to collect the lot of samples. So we must aware incident on which date and time. And many of the accused caught by the public and the police, if it is caught by the public, they must be have a physical assault to them. So we must aware of that thing also. And brought by whom, whether it is brought by a public or the police person. If it is not clear, we can seek for first information report, that is FIR, from the police. Now the question is when the victim and the accused brought together, whom I should examine first? My answer is a victim, so that we will get the information from the victim, what are the injuries inflicted by the accused, and what are the defensive activity that causes the injury to the accused person, that can be correlated during the examination. It is preferred that one doctor should, who is conducted the victim, same doctor should conduct the examination for accused examination, so that a lot of evidences can be get from that both victim and accused. Now, this is a photograph of our clinical forensic medicine. One accused brought for potency examination for sexual offense cases, and is with the cuff with the police. Usual day-to-day challenges what we are facing with the accused that make a more nuisance while doing the examinations. Better it's along with the escorting with any one of the police inside the examination room, so that we can make some protectiveness from the accused. And coming to the next slide regarding the requirement for the before examination consent. In this part, the forensic nurse must be aware of why in these type of cases whether it is required or not. If it is brought by the public for that accused examination directly to the doctor, then it is required. But we have to explaining to the accused that these report can be against them and furnished to the police and court of law, and they have the rights to refuse also. So if they are refusing, so we must document that refusal in that report and forward it to that investigating officer or to the court. And it is not required in that such scenario, like if it is required requested by the police according to the section 53A of CRPC, for that consent is not required for doing an examination of an accused in the sexual offense cases. So even though that if it is requested by the police, still the accused is refusing for giving the consent for the potency or accused examination, we have to document in that report the person has refused for the accused examination in the sexual offense, and for the collection of medico-legal evidences, so that later on with the court order or court prosecution based upon the court order, we may conduct the examination in future, and we have to inform that these refusal to the in the report and forwarded to the investigating officer forwarded to the court. Coming to that requirement, so before starting the examination, we must prepare what are the requirements needed for the medico-legal examination. This is evidence collection tray which is in our department. Actual, that is cotton swab, test tube vials, that is violet, it's for EDTA for DNA preservation, gray vial, that is a fluoride vial for blood and drugs and alcohol detection. That is a 3 number is showing a FDA card, that is Flinders Technology Associate card, particularly for DNA preservation, and the lancet, syringe, needle and tonic for collection of blood and those things, and scissors for cutting the hairs, nail cutters, and glass slide for swab making, and magnifying lens for better visualizing of minute the injuries, and the gauze piece, and the distilled water or normal saline for collecting the swab, and the urine container for getting that urine sample for the detection of alcohol and these drugs, and the inch tape for normal measuring, and the gloves as per size of examiner. These should be ready before starting our examination. And after that this thing, once the case is received, as Dr. Varuna showed, the MLC register. In that thing, we have to fill the register with the proper documentation with the legible handwritten register, so that in future, if we are referring, it can be clearly visualized by any one of them. So, and proper numbering of MLC number and examination done by which doctor you have to mention. If it is assisted by any one of the nursing assistants, so we can add their name also, and police station investigation officer name, and constable who is escorted along with the accused, we have to document and sample. What are the samples preserved for these particular case, we have to mention, and it was received by whom and handed over. Proper chain of custody will, it should be documented in that MLC register. After that, we have to look for two tattoo marks, two identification marks that should be maybe tattoo or mole or skulls. Better in externally visualized area, not in private parts or clothing that are hidden by the clothing. Better you can get the two ID mark from visualized exposed area like face, hands and legs you can take. And after that, I am going to the examination section. That's similar, more similar to the victim examination. First of all, we have to, especially with the fresh cases which is coming for the examination, make them to stand on the white paper which was put on the floor, and ask them to undress himself. If possible, you can look for fall of any debris or any item like long hairs of victims or any other items belongings to the victim we can seek, and if it is falling, you can collect and you can preserve it for separate things. And other thing is outer and inner clothing should be preserved separately along with white paper which was kept on the floor. And after this, once the person has undressed, we must make sure that alternative clothing is available. Most of the places, this is one of the major issue we are facing, that they, especially with the accused person, we are collecting that dress sample. They are after that they are become nude and they are not having the alternate clothing. Make sure that if these things we are going to be done, the alternative clothing should be present or not. So we must arrange for that alternative clothing. Coming to the next step of our medico-legal examination, we have to make the position for the patient for examination. Before that, we have to make sure that adequate light source, whether the injuries and these things are properly visualized in adequate lighting setup, we have to ensure. After that, we have to do the general physical examination and external examination, look for external injuries in the standing position. And after this thing is over, we have to go for genital examination. That should be done in a supine position only. So coming to the role in a medico-legal examination for assisting, the doctor can conduct the examination, but the nurses especially can aid for proper visualization of injuries and a genital examination, including the checking reflexes or pulsation and etc., which can be the what are the examination that will be covering in forthcoming slides, and they may helpful for proper documentation of exact findings like injuries in exact location, and they can give an idea of plan of evidence collection if they are seeing bite mark over the accused person, so that they will give some clue or idea to the doctors for collecting the swab from the oral side to detect the victim DNA, so that they must you should aware of these things, what are the samples you should take and what are the findings You should note I'll be telling in the forthcoming slides. And assisting for the evidence collection. As I told, the biomark swabs and the blood in FTA card. Even that most of the places in India that nurses are collecting the blood and for medical investigation. I don't think so, sir, for the DNA sampling for the particularly blood in FTA card. You must be aware what are the things you have to do while collecting the blood, and you don't want to do at the time of blood in the collection in the FDA card. That will be covering in next slide. And that as victim examination, they have told pubic and scalp hair combing and collection also, and penile swab. We have to collect the penile swab when it is as per many publication and international standard books within 96 hours of this incident time. We can collect the penile swab, look for vaginal cells and secretions of vaginal secretion, and that could be positive when it is collected within 96 hours. And clothes preservation, I already told, make sure that alternative clothing is present, nail clipping and nail scraping also, oral swab and smear, and blood for alcohol and drugs requested by the police. And this is the step for collecting the blood in the FDA card. Now the question will comes, if the FDA card is not available, what is the alternate source of collecting the blood? We can collect in the gauze piece also. So that will be available in anywhere. So that is not necessary you should preserve in the FDA card. There may be available that in blood on gauze also you can prefer if it is FDA card is not available. So step 1, you must wear the glove and mask. What's the need of mask? I will tell in next slide. And open the pack of FDA card, there will be a circle inside and name, ID, sample and date. We have to fill the name, ID, number and date, and use only the lancet to prick the finger for getting the blood, and you make it as particularly to these circle we have to keep for blood. So why we are using these FDA card for DNA analysis? This is a porous paper. This will lyse the RBCs, especially with the A nucleated cells, and give the more retrieving chances of getting DNA from the FDA card after lysing the A nucleated cells. And coming to the next thing, do's and don't do's. Use only the lancet for pricking. Why? If you are using the needle for pricking, that will overstrains the paper, and again you will have to dry it for more number of time, and it will not it will more beyond that circle. So the processing of the samples will be very difficult. So use only lancet for pricking, and use mask and glove, so that examiners saliva while you are talking and laughing in front of the FDA paper, the splittings of examiner saliva or any other secretions, that will lead to artifactual detection of DNA, especially in these examination of sexual offense cases. That will create more issues and challenging to prove the evidence in administration of justice. So we have to ensure that use of face mask and gloves, and don't talk in front of while collecting, and these precautions should be maintained while collecting the FDA card. Coming to that sample, in that I want to convey in these things for accused examination, the main aim of collecting sample is to detect the DNA of the accused or evidence of the accused. In vice versa, for the victim examination, we have to look for the evidence of accused in case of victim. In case of accused, we have to look for the evidences of victims. And coming to the samples, what are the samples we can take? Why? What's the reason behind these things? I want to discuss here. Scalp, pubic hair, cut strands of pubic hair combing, head hair combing, clothes. So we can get the history. If the person have not changed the clothes or not took bath on contact during the sexual intercourse, these history is there. We should take these all those samples. And coming to that oral swab and slide making, especially with bite marks on the victim, actually we should supposed to take the oral swab, or if we have to look for in between the teeth some debris are there, we with the dental floss we have to retrieve the debris from in between the tooth, and we'll send for these thing evidences for forensic science laboratory. And if it is a oral sex history is there, that is a buccal coitus called as, we should take the oral swab and slide from the accused. And especially with the hand swabs from the fingers with web spaces, we have to look for any debris, especially with the history of inserting the fingers in the genitals or manipulating the genital area, so that we should take the hand swab along with nail clipping and nail scraping and blood for DNA analysis. That is, if the person, if the victim, in that thing we are getting the blood stains of accused, that can be matched and with the DNA and blood grouping. And if it is a victim got pregnant and the MTP is conducted, so that the accused and this product of conception will be matched by doing the paternity testing. And as I told, blood grouping for stains from in which the victim can be matched, and blood and urine for testing alcohol, especially with the history of some drug abuse or under influence by the accused. If it is requested by the police, we should take the blood and urine for testing the alcohol and drugs. And as I told, penile swabs, particularly from the glands, penis, and previous foreskin of that penis, should take the penile swab along with the control swab. So we have to look for the vaginal secretion and cells in that penile swab. And nail clipping and nail scraping, that is for the DNA of the victim during struggle, we may get the debris in that nails, in so that nail scraping and clipping may detect the DNA of a victim. So after finishing this packing of clothes, if it is a clothes or wet, we have to keep it dry under, if it is possible, we can use a dryer. If it is not possible, we will take in room temperature, we dry. So with wet clothes, you don't pack and send in the paper envelope. If we are keeping that, we will lose the evidence by growing the fungal growth in that clothes, and especially with the stains that may deplete the DNA detection from the clothes. So once all the clothes are become dry, and make sure that outer clothing and inner clothing will be in separate packings. So we should preserve in the paper envelope separately along with the white paper which is put on the floor. So we have the packing the sample of separate envelopes for keeping all those samples, which should be packed separately, and not incorrect sampling should be packed in different envelopes. It will be particularly named. If it is a scalper, you should preserve in that scalper envelope only. This is a one envelope we are day to day we are practicing. We are preserving in this envelope by stating FIR data, number, dated, police station, and sample preserved. What sample? That is blood for DNA analysis, and the signature of doctor with the date and time we should mention in that envelope. Once these thing is over, we must doctors drafting the report of accused. So you can assist by stating that I will discuss. Before that, what are the parts of sections of report we must aware? That is a preamble, body of the report, and conclusion of the report. In that preamble of the report, this contains that this is the one of the model of medical examination and a potency test of an accused in a POXO case, that is under section 376, 506 and 6 of POXO Act. We must aware what is a preamble it should contains. That contains the department number, date and time of examination, and date and hour of report sent to the police. We must ensure that these should be dispatched within 24. Better immediately you can dispatch the report. And FIR or DD number under section police station, and we have the separate MLC number which have been put in emergency along with the emergency number dated and name and the agent's sex and entire details should be mentioned in the preamble and brought by whom. And what is the alleged history in brief in online we should write, and as mentioned in a request paper forwarded by the IO, and you should mention the IO is present or not. We should mention during these examination, especially with the accused, we are facing is making a nuisance, refusing and speaking in obscure manner while dealing the examination. In that such situation, if IO is not there, we call the IO and we have the rights to tell that these things they're refusing and using obscene language to torturing these and all. We should mention in that report, and that should be mentioned in the report, and that may causes the examination, affect the examination part, so that in better way we should mention in that report part. And coming to the next thing is a mark of identification that I have discussed. This should be in the preamble of the report. This is for normal cases I have discussed, and in some cases the accused person can defend himself that I have erectile dysfunction, I have impotency, particularly while dealing with the elderly accused. In that such scenario, we must aware of these, what are the questions, what are the history we have to take, that we must aware. Do you have erectile dysfunction, whether yes or no? If he is saying, if it is yes, how long it is present, it is acute or chronic, you must ask. And do you have inability to achieve maintain erection, or you be able to penetrate or not, and all we can ask. If he is allowing to which the accused is well obeying to our commands, and that every normal that erective dysfunction history I have mentioned here. I am not going in depth. This is all the duty of doctors should ask this question, and you should aware of these things. And other medical history that causes the importance also, we must aware of these things. Especially the most commonest cause for importance is psychological changes that we must aware, and followed by hypertension, diabetes and tuberculosis. So we have to ask that type of history, and the history of sexual transmitted disease, and history of mental illness, and any stress, having psychological stress, so we have to ask, and family history, and history of drug abuse also we have to ask, and history of any head injury, spinal injuries. Sometimes the spinal injuries causes the this erectile dysfunction. So we must aware of these all, ruling out of all that history. With the negative history we have to document if it is claimed by the defense, claimed by the accused. Coming to the general physical examination, we have to see the height and weight, chest girth, abdominal girth with along with the inch tape, and general behavior, whether it's weighing and that we have to tell, and the mental condition, whether he is irritable or cooperative, and we have to mention in that general physical examination. These all will be that general behavior and this thing will be examined by the doctors, but you can aware of these things. And gait, intelligence, and any marks or injury scars on the body, and beard, mustaches, and particularly in that thing, if it is a loosening of hairs, especially the cases, fresh cases we are dealing, any loose hairs or presence, especially with the beard and mustaches, we can collect that evidence for DNA matching, which can be detected in the crime scene, or the victim can be matched in future. And coming to the local genital examination, it should be done in a supine position. We have to measure the length with the inch tape, stretch penile length, length when it is erect, that normal ranges, and circumference of the mid shaft, and any disease, deformity, and the testis is present in the scrotum, that we have to check, and the sensation over the glands we have to check. Foreskin, whether it is a retractable or not retractable or circumcised, we have to mention, especially with the religious aspect in Muslim, that is usually that is circumcised, that we should document it properly, and that is usually missed while examined by the doctors. And dorsal penile pulsation we have to check. And that scrotal examination, I have told, it is pendulous, the testis is present in the scrotum, and developmental defect, deformity, and cremastic reflex, that will be conducted by the doctor. But you should aware while seeing the cremastic reflex, what are the sharp instrument that may be due to some sticks or something. It's required while scratching with the medial aspect of the thigh, that can be that cremastic muscles can be response with that while doing that stimulating the medial aspect of the thigh. So you must aware of these cremastic reflex, how the doctor is conducted, and how to see, and what are the requirement for these things is necessary. And it's not only for these medical legal investigation, particularly for these defense, especially with the accused or saying that I am important, we have to rule out other possibilities by doing the medical investigation, like blood sugar level, fasting and postprandial, follicular stimulating hormone, and luteinizing hormone, testosterone, prolactin, VDRL. And if it is possible, if we are detecting some atrial pulsation is not detected, we can go for penile Doppler ultrasound, both the atrial and the venous flow of the penis, so that if we will get the report, we can frame the opinion. In that opinion, the doctors are framing the opinion. It should be in a double negative. That is, there is nothing to suggest. If it is not a potent person, if we are potent based upon our investigation, we are framing that there is nothing to suggest that above examined person is incapable to perform the sexual act. So if it is impotent, if we found in the medical investigation by multidisciplinary approach by urology department, psychiatry, and forensic medicine, if 3 doctors are agreeing the person is incapable, then we have to frame that there is nothing to suggest that above examined person is capable to perform the sexual act. Then the next thing is final thing we have to do is a very important thing is checking the report before dispatching to the police. As we know that any grammatical or typographical error while typing, because we are the doctors, we have dealing many number of cases per day, so we'll be more tension. So if we are assisting and helping, if we are noticing these errors, so that will be useful for us, and we'll give the correct report to the police, and whether it is a signature and seal in the report it's properly is there or not, and the packing, correct labeling the sample preserved, and proper sealing is done or not, and maintaining the register. So these in this part, if you are concentrating, so that we will have a more support while doing the medico legal examination. We won't lose even the minor evidence on the person, so that will be more useful. Coming to the next slide, we are not restricted to the only to that examination. We are supposed to attend the court. If it is someone witnessed by the court, we have to go to court. This is one of the summon I got it in last March actually. It's a case of potency, that is a sexual offense examination I have done. That is so that they are giving the summon for giving the expert witness. So in front of defense and public prosecutor and honorable judge, we have to give the expert witness in the court based upon the report we have prepared and what are the samples we have collected. Now the thing is now that debate is whether the forensic nurse can attend the court or not. Yes, if I say yes, if the in the report the person who is assisted, if the name is mentioned, these are for assisted for evidence collection for this person by this nursing assistant, if it is mentioned, and if she or he is signing the report, and it was noticed by the honorable court, and if they are summoning to that particular person by stating that doctor sorry nurse so and so nursing assistant, and giving witness for the evidence collection, if it is summoned by the court, you should attend. This is up to that discussion level. In future that may happen, that so in that I'll be completing my presentation. Thank you so much for giving this opportunity, and thank you for the technical team who are working here without any technical issue, and thanks to technical and the local supportive team also. Thank you.
Yeah, thank you so much, Dr. Venkatesh, because you have explained it in a so detailed way, in the easy and a very ease manner, how all things and we have to do and what will be our responsibility, and when we conduct any examination. Okay, now, ma'am, are we going to take up some questions or at the end? Sweta, do we have the questions in the chat box?
3 to 4 questions in chat box, ma'am.
Are we going to take up now, or will we moving forward and we can take up the question at the end? I think that's, yeah. How many questions are there?
Ma'am, 3 questions.
Yeah, you can go forward with that.
Ma'am, can I take the questions now? No?
Yeah, only those 3 questions, not more than that.
Okay, ma'am. Thank you for your elaborate session. Then we have 3 questions, sir.
Yes.
First one is, consent is taken by suspect also for specimen collection. And what if suspect denies to give consent?
We can't force them to collect the evidence. If he is refusing, we have to document the refusal for the consent for particularly for medico legal evidence collection, and they have rights or for refuse also. So we can't move against them. So let's document the refusal of the consent and forward to the court, and court will decide whether it is necessary or not. If it is necessary, the court order will come to us, and the person have to be coming with us. So on that time we have to collect. Apart from that, if his suspect is refusing, we are not supposed to be take the sample from that person.
Sweta?
Yeah, sir. So thank you, sir.
Sweta?
So then the next, yes, ma'am.
1 second. Sweta, can you make Lata ma'am as a co-host?
Yes, ma'am. She is ma'am. She made ma'am.
Okay.
Yeah. Dr. Venkatesh, your presentation was very clear and so many practical aspects were shared.
Yes.
I think we have to host multiple sessions to teach the skills what is required for nurses to
ma'am.
practice in
Sure,
the forensic
sure.
department. Now I think we are behind schedule.
Okay.
So we'll continue with the next session, and at the end of the session we can attend to the questions, because this is a new subject for nurses. There are a lot of
Yes, yes.
questions pouring in, but unfortunately we have very less time. So we
Okay.
will complete the next session.
Okay,
We
ma'am.
will,
Thank you so
take
much,
up
sir.
the questions.
Thanks.
Thank you.
Yeah. Thank you, Dr. Venkatesh. Now I would like to invite our next speaker, Dr. Karti Vignesh Raj K, currently working as a senior resident in the Department of Forensic Medicine and Toxicology in the AIIMS New Delhi. He completed his MD from JIPMER, and during his PG program, more than 1,000 autopsies were adhering to the standard dissection procedures was done, and he has experience in the clinical forensic medicine also. And he was conferred with many awards like Best Paper Presentation in many conferences, and he's a gold medalist for the Best Outgoing Postgraduate from the JIPMER in the year 2020, and he has many publications in his credit. Now I would like to request Dr. Karti Vignesh Raj K to deliver the session on Indian judicial system, laws pertaining to the medical profession including nursing. Over to you, Doctor.
Thank you so much for the introduction, madam. So, am I audible to the gathering?
Yes, sir. Yes, sir.
Thanks a lot. So, greetings to the gathering, to the privileged gathering over here, and the topic allotted to me is Indian judiciary system and laws related to medical profession, including nursing. So, this is a topic which is a collaboration of three oceans, is what I consider. So, the collaboration of the ocean to be presented within 30 minutes with having the restraints in my mind, I just made the preparation. Hope this will be helpful to you. So before getting into the presentation proper, I'd like to give a few disclaimers. Means a few case reports or newspaper clippings I had included in the presentation. So those are exclusively only for the academic purpose, rather than it need not be. I mean, it is not good to discuss the other things. The reason is that few are alleged cases and few are judgment has been given to that. But still, we'll stick on to the discussion. Of the cases legality related to those scenarios. And then those few cases which I have quoted, I have tried to list out in which nurses are predominantly involved. The reason is that training is of two types, is what I feel. One is to tell what you should do, and the other one is what you should not do. So this topic is more in favor of the second topic, and I choose that route. So please don't take it in the wrong sense that I'm against the collaboration of forensic and nursing. So this is I take the privilege in welcoming this collaboration, but hope we'll join hands together for the better service of the community. So with this in mind, I'd like to move further. So I like to presentation with a quote or a phrase stating lack of knowledge is both fearful as well as tearful. So there are no doubt that the doctors and the nurses are, it is no doubt that they are not lawyers, but they have to equip themselves with the basic level of law which is required for the safe medical practice, is what I feel. So this is the high time for each and everyone gathered here to know what law is and what are the laws which guide and guard each and everyone's practice. So henceforth in the slide, I'll be mentioning the word, the letters HCP is for healthcare professional. So please have it in your mind. And I like to introduce few terminologies like forensic medicine. It deals with the application of medical knowledge towards the administration of justice. In a simple language, it can be told as a medical aspect of law. And next is law is defined. What does law exactly mean? It is defined as rules of conduct. It is enacted by the concerned authority. So in order to maintain the peace and to control the people who could threaten the public safety. So since law is a notion, it has been organized in a systematic way. So based on that, the types of law I have just I'd like to quote. One is the procedural law,
Next is the substantive law, and next is the medical law. So what is procedure? What is procedure law? The name itself says. So it is concerned with the guiding procedures which should be followed diligently to solve the legal disputes. So, for example, like what we people, previous presenters, like they have quoted related to code of criminal CRPC, that is criminal procedure, code of criminal procedure. So it tells us the procedure to do in such a when such a dispute happens, like medical examination of a victim, medical examination of an accused, or inquest procedures during the post-mortem examination. These all come under the code of criminal procedure or CRPC and Indian Evidence Acts. So what is substantive law? It is nothing but the law concerned with establishing the fact of dispute in question and to deliver justice. In other words, whatever criminal whatever acts which has been performed for the corresponding punishment which is being given according to this law. So Indian Penal Code comes under the substantive law. Next is medical law. It is a branch of law which is concerned with the rights and responsibilities of doctors and patients. In other words, it can be told as laws related to doctor-patient relationship. So our main focus is on these three laws in the subsequent presentation. So I like to delineate between law and act. What does a law exactly, whom does it cover? It is mainly for the concern of the general public, for each and every individual of the country of India. This laws covers, like Indian Penal Code, Code of Criminal Procedure, and Indian Evidence Act. Next is, what does an act mean? Act is specifically for a particular group of people. For example, POCSO is nothing but POCSO, Protection of Child from Sexual Offences Act, which Dr. Abhilash has explained nicely. So, CA is nothing but Criminal Amendment Act. These two acts are laws laws which are related to the related to rape. Next is MTP, that is medical termination of pregnancy. This is revolves around the legal or illegal abortions which has been caused to the pregnant women. Next is PCPNDT Act. This is nothing but Preconceptional Prenatal Diagnostic Techniques Act. This revolves around pregnant females and female infanticide, sex selection. So this is the particular group of people who are involved. Next is TOHA, is nothing but Transplantation of Human Organ Act, Organ and Tissue Act. This is mainly focused on the issues related to organ transplantation. So having this in mind, I would like to brief out the laws which are related to the healthcare professional and the acts which are related to the healthcare professional. So what does it mean? There are three types of laws which is related, that is conduct law, consumer law, and a criminal law. The conduct law, the respective medical council, that is either let it be a National Medical Council or a Nursing Council Act, those people, they take action against in cases of professional misconduct. Next is the consumer law, which the Consumer Protection Act is the chief, is one of the chief related to this. So any breach in contract or in case of any civil negligence, the Consumer Protection Act has three levels: national, state, and the district level of forum redressal agencies are there. They come into action. Next is a criminal law, which is according to the IPC, like a punishment which I initially quoted. Next is the acts which I have already, which I have given the short form, the expanded things. I have mentioned it here. The same things are being listed again. And apart from this, the Mental Health Care Act is which was not mentioned there. You can have a view on this. Next is laws pertaining to the healthcare service. Let's jump into the topic proper. So I like to quote few scenarios and a few IPCs. Hope this you can understand better. So Section 52 IPC is nothing but good faith. It defines what good faith is. Let us consider a healthcare profession is treating delivering a treatment to a patient. So this delivering the patient is considered to be an act. So this act, if it is done adhering to the standard protocols, which following the proper standard of care, due care, then it is considered to be as good faith. So the defense Section 52 IPC comes in such a scenario to a healthcare professional. Next is Section 80 IPC. It is accident in doing a lawful act. So this is a well common scenario which in hospitals in a day-to-day setting. So when a healthcare profession, he treats a patient with due care, that is he is giving a good faith and he is treating. In the due course, due to the let it be due to the complication or due to unavoidable situations, the patient has expired. So here the healthcare profession has a single intention, that to save the patient, and the knowledge which he has gained, the knowledge is mainly to save the patient. So here with all this knowledge, he is working out to help the patient to save him. But unfortunately, if the patient is expired, so this is considered to be as an accident or a misfortune. So the section 80 IPC defines an accident in doing a lawful act. Next is section 88 IPC. In this is another example I would like to quote is a surgeon performing a surgery on a terminally ill patient suffering from a severe pain with after getting a proper consent. The surgeon very well knows that there are chances that the patient may expire, but in spite of that, he gets the consent and gives offers all the good faith due care he gives, and finally tries to save the patient. So this act is for the person's benefit, and he does it after getting the consent. So this explains the scenario which I had mentioned. So next is the emergency cases. This is the most thing, which is the most important thing, which each and every fraternity from medical as well as in nursing council, nursing people, they need to know. So handling emergencies in emergency department. So the section 92 IPC, it clearly says that no consent is required in any emergency cases. So irrespective of any medical or medico-legal case, it is a duty of a doctor to deliver the treatment with the due care without causing any delay, stating any issues related to consent or any monetary issues or any authentication required. So this was very clearly explained in the landmark judgment, which is the patient Paramanand Katara versus Union of India. The Supreme Court of India has delivered the guidelines which has to be followed related to a Good Samaritan. The Good Samaritan is nothing but a bystander who brings the patient and he admits to the patient in the hospital. So related to that, they had framed the guidelines, and one of the highlight feature is medical help. It has to precede the legal formalities. So legal formality should not be a hindrance in offering the patient to the medical to offering the treatment to the patient is what I would like to highlight to the maximum. So an example which I would like to give is a healthcare professional seeing a patient bleeding, and he's almost fighting for his life, and at that time initiating the treatment, the nurse who's responsible to receive a patient and initial stabilization. So it is your duty to take come into action, who are the torch bearers in the initial thing. So they play a major role in this. So you have to remember that section 92, no consent is required in emergencies. Next is the laws relating to the consent, section 89 IPC. Let's consider a child who's less than 18 years. According to POCSO, a child is defined as less than 18 years of old, they are termed as a child. So any procedure which has to be done on a child, the consent has to be got from the parent or a guardian who gives the consent in a good faith. So this defines section 89 IPC. Next is section 90. So this is a skill, more than a section, it is a skill which we have to acquire or which have to learn, which each and every healthcare professional has to learn it. So consent, it must be free and it must be obtained free and voluntarily, and no compulsion or threat should be involved. For example, if a healthcare profession is trying to convince a patient or explain to the patient about his medical ailments, and so he has to explain in such a way that the patient himself gives the consent. Like he has to explain what is the medical ailment he is suffering from, what are the probable modalities, how much cost does it take to each and every procedure, what are the better alternatives, and what is the complication, what is the benefit of undergoing such things. Everything he has to explain in such a way that the patient himself could give a free and voluntary consent, rather than it is being obtained as a result of compulsion or a threat. Section 91 IPC. So consent cannot be a shield to each and every medical profession and healthcare profession in all scenarios. If an unlawful act is being performed and stating that the consent was given by the patient, then automatically the healthcare profession is under severe actions will be taken. The reason, for example, let us take a scenario where miscarriage of women, it is considered to be as an illegal act as per the medical termination of pregnancy if proper indication is until the proper indication is not there. So in such a scenario, if a person conducts MTP and states consent as a shield, which is it cannot be so, because section 91 IPC is there. Next is section 93 IPC. So a communication which is made in good faith is not an offense. consider a scenario where a healthcare profession is trying to explain to the patient who is terminally ill or who's not a terminal or a normal patient. Let us consider he's trying to explain when the patient is listening to the healthcare profession, and his medical scenario is such a way that it is very complicated, and the healthcare profession is trying to explain it. Listening to that due to shock if the patient dies. So here the communication was done in a good faith, and hence by this the healthcare profession is protected. Next is something related to section 29, that is a document or medical records. So medical records comes under a document. So this section 29 IPC holds good for medical record also. Document also. So the word denotes that anything expressed or documented upon anything by means of figures, letters or symbols, which can be used as a proof and an evidence in legal dispute. This is what the word document is described or defined. So medical record is also considered as a document. Next is I'd like to quote a case scenario where High Court, Uttar Pradesh High Court has fined 3 doctors for for giving a report with a bad handwriting. See, like what I had defined already, this medical certificate which is being delivered, if not furnished with proper details and with the poor handwriting it is being delivered, it will be considered as impeding the progressing investigation. So by this, the charges can be given to the doctors also. The reason why, how it is the application of this in the nursing field is that there is a habit of writing a prescription, giving a prescription slip to the relatives to get the medicines from the shop or wheresoever it is for the patients who are admitted in the ward. So when such a prescription slip is being given, it is better to follow, or it is better to write each and every letter in the capitals, or write in a capital letter in such a way that unnecessary confusions can be avoided. So for a better safe practice, we can tell. Next is a criminal liability of an related to healthcare profession. So 304A. So it defines causing death by negligence. So any act which is being done in a rash and a negligent method or way, it can be punished with 2 years of imprisonment or fine or both. So here neither knowledge nor intention to cause the death is established. And so this in order to prevent unnecessary allegations against the healthcare profession, there is a landmark case by named Jacob Matthew versus State of Punjab. So as per the Supreme Court direction, a procedure has been framed so in such a way that until and unless the prima facie, that is the facts of the crime, is being proved with the help of an expert opinion of the same field or any committee of experts, the alleged doctor or a nurse or any healthcare profession can't be arrested. So if the committee says that the rash is simply rash, if the act done is simply rash, a civil liability can be filed. However, in order to tell it as a criminal negligence or to file a criminal liability, the negligence has to be very gross and the act has to be very reckless. So let me try to relate the 304A with few examples from the newspaper clippings. So where a pregnant woman has with the blood group, I'll just tell the news instead of reading this. So a pregnant woman with the blood group B positive, O positive, she has been donated. She has received a blood which was not properly screened for HIV infection, and the blood group which she received was B positive. So O positive is a universal donor. She can accept blood from the corresponding O only. So when this was given, anaphylaxis happened as well as she was contracted with a HIV infection. So later on, there occurred a claim that police had filed FIR against the doctors and nurses. So the thing which we need to look into this specifically is that proper screening has to be done, which was not done, and the act of checking the blood group before initiating the transfusion was not done, leading to the committing of gross negligence. Next is scenarios where recently happened during the COVID pandemic, where on the onset of fire in the ICU, 11 COVID-19 positive patients were burned to death. So in this scenario, the duty here is of the healthcare profession is to save the patients from the mischief which was happening inside, rather than saving what was happened was they nurses went out as well as the medical officer was on leave, and here the knowledge was knowledge to cause that if the patient are there inside it will cause death, it was present. Intention to save the patient was not there. That's the reason why gross negligence was confirmed for not saving the patients inside. Next is a Mumbai nurse gives a 2-year-old an injection which was meant to another patient. So the standard of care here, what a nurse has to ensure is that administering proper dosage to a proper patient who was mentioned, and before administering the injection, a proper test dose if required has to be given to rule out anaphylaxis reaction. So this standard care was not delivered, and this became a landmark judgment that doctors are not liable to personally monitor the administration of injection by a trained nurse. So deviation from the standard of care was there. Next is 336 IPC Act endangering the safety of others. So according to this, 3 months of imprisonment and fine up to 250 can be charged. So I'd like to quote an example where a healthcare profession comes to his work under the influence or under any inebriance, then even though the event which he is performing is uneventful, he or she can be charged under this section with 3 months of imprisonment and 250 fine. And next is 337 causing hurt by an act endangering the life and safety. So this attracts 6 months of imprisonment and fine of rupees 500 or both. So according to this, if hurt is anything which is defined as any harm which is caused illegally to a person's body, mind, reputation, so and infirmity. So in this scenario, let's consider an example where administration of a test dose, without administering a test dose, a drug has been injected and anaphylaxis has happened. So the anaphylaxis here produces body pain or infirmity. So this is the injury which has happened or hurt which has happened to the patient. And even though finally the patient has recovered, but even though she has recovered, she can give a claim that she or he has underwent hurt, and the concerned healthcare professional can be charged with this section. Next is causing grievous hurt by an act endangering the life or safety of others. So this attracts 2 years of imprisonment or fine up to 1,000, or with both. So grievous hurt is defined as, there are 8 clauses to define a grievous hurt, which is emasculation, permanent privation of sight of either eye, permanent privation of hearing of either ear, privation of a member or a joint, destruction of power or loss of member or a joint, disfiguration to the head or face, fracture, dislocation of tooth or any bone, or any act which endangers the life of any person and makes him to suffer bodily pain for a period of 20 days with disturbing his ordinary life is being disturbed. So this is the definition of grievous hurt. So any healthcare profession causing such type of grievous hurt to a patient can attract this punishment. The reason why I have told is, and all these acts are like I told, rash and negligent. The reason why I mentioned these 3 acts is there are still such type of things happening. Allegations are there in the news. I don't know the confirmation of this is because since it's a news clipping, I just wanted a legality related to this. That's it. And a drunken nurse thrashes a 2-month-old sick boy with this happened in Delhi only. And under the influence, the nurse has gone, and this is what the allegation which was given. And this attracts punishment 336, along with, if it is a hurt, 337, if it is a grieve hurt, 338. So next is laws related to abortion. So this deals with section 312 to 316 IPC. So 312 is abortion without any good faith. So like what I've already defined good faith. So any abortion which is done without good faith, even though the consent is present, it attracts or the punishment can be given under section 312 IPC. So if it is not quick, that is quickening is feeling of the baby movements in the abdomen. So if it is not quick, punishment up to 3 years of imprisonment. And if the quickening is felt, it is punishment up to 7 years. It can be done. Next is section 313 IPC, abortion without consent. In this scenario, same which I told for 312 is applicable, except consent is not here in this. So in this, 10 years of imprisonment and maybe imprisoned for life also. Next is section 314 IPC. It is death caused due to abortion. If consent is present, 10 years of imprisonment. Without consent, it is life imprisonment. And section 315 IPC, it prevents the child from being born alive or cause it to die after birth. So if the intention, even though the intention is good, if the child is being dead, then this attracts this punishment. For example, I give you example, an unmarried child, an unmarried woman comes with advanced stages of pregnancy, that is more than 28 weeks, to a healthcare profession, and if abortion is being performed, then the healthcare profession can be filed under this section. Section 316 is causing death of an unborn child after attaining a period of viability. The reason why I'm shouting or discussing the IPCs 312 to 316 is with the punishment is due to the strict implementation of the Medical Termination of Pregnancy Act, which was recently amended in 2021 also. So according to this act, only a registered medical practitioner is allowed to do the act of medical termination of pregnancy, and it attracts 2 years of rigorous imprisonment, and it may extend up to 7 years of imprisonment if any other person does the act of MTP. So if any person approaches you people, then you can very well clearly quote this as a reason, or you can refer it to the registered medical practitioner, and it is a duty to give a counseling to such patient related to the case scenarios. So next is only in approved places the MTP should be done, and the approval also and the places also should be under strict surveillance, like periodical renewal has to be done, and proper documentation of intimation to the concerned district health authority related to the abortion has to be mandatorily maintained. So this attracts the same punishment which as mentioned in the slide. Next is 2021 amendments. So age limit for conducting MTP in case of rape survivors or victims of incest or vulnerable women, the age is increased. You just remember that the age is extended till 24. I don't like to mention the previous thing, because if for a new learners, let this be the benchmark. So it is extended to 24 weeks. And if it is a case of substantial fetal abnormalities, it beyond 24 weeks, the MTP can be done. Next is how many doctors are required, or how many registered medical practitioners are required to conduct this. If it is the gestational week is up till 20 weeks, only one registered medical practitioner is enough to conduct it. If it is more than 20 and less than 24 weeks, 2 RMPs are required. And if special scenarios where more than 24 weeks, like I already mentioned, in such a scenario, a state level medical board approval is required to perform the act of MTP. So the most important thing is to maintain the confidentiality of women who is undergoing MTP. If it is not maintained, then the mentioned punishment and imprisonment are liable. Next, this is a case scenario where a nurse was held responsible for carrying out an illegal abortion. So she was working associated with the government service, and from there she took the medicine and used it to perform the act that in her house. So this MTP was conducted was not as per the norms. And retired nurse in Kulakshetra, the same scenario was happened where the MTP was not conducted as per the norms. Next is PCPNDT Act. So the main agenda or main purpose of this act is to prohibit the sex selection, that is to prevent the female feticide. Is the main motto of this. Apart from that, regulation of the techniques which is being used to conduct, like the ultrasound, etc. Those things, regulations, it is being monitored under this act. So what are the offences under this PCPNDT Act? So advertisement is prohibited by any means. Registration is a must with prior approval of the supervisory boards, and the renewal has to be done upon constant inspection by the central as well as the state supervisory boards, and proper documentation of the patient detail is needs to be checked, and declaration of the patient and doctor related to sex selection is a mandatory thing which has to be adhered. And next is the consent of the patient is at most required. So contravention to these PCPNDT rules attracts the punishment as highlighted, and removal of the name will from the medical register will happen during the process of inquiry. If the conviction is confirmed, then a removal of name for 5 years from the register will happen, and on subsequent conviction, permanent erasure from the register, corresponding council register will be happening. So any person who is interested in knowing the sex of the fetus of the pregnant woman without any specific indication attracts the punishment as listed in the slide. So a similar scenario where a doctor, nurse and 2 medical men were arrested just because in the nursing home the sex determination test was performed. Next is a similar scenario where Udaipur nurse was involved along with the doctor for performing a sex determination test. So here, in this scenario, the doctor didn't maintain the records related to sonography, and the sonography center, the ultrasound machine, was not registered properly to the government, and this attracted the punishment. So next, moving on to wrongful restraint and confinement. So the section 339 and 340 is for wrongful restraint and wrongful confinement. Restraint is nothing but voluntarily obstructing a patient to move in a particular direction, and so this why this point is required is, let's get into the mental health bill 2017. So this is the reason why it is I have quoted there. So every person shall have the right to access the mental health care and treatment of the in the respective mental health services which is run or funded by the appropriate government. So every person with mental illness has the right to live with dignity and right to have the confidentiality related to the treatment purposes on mental health. To access his medical records. So restraining an uncontrollably mentally ill person during outbreaks by cruel methods like using chains or beating, it is an offence under section 81 section 81 Mental Health Act 1987. So if then you can ask me, sir, then how can we restrain the person? So in such a scenario, methods like sedation and locking up the person in a particular room with proper safety measures and notifying the concerned authorities that such and such person has been restrained for such and such time period is a procedure which needs to be followed. So apart from the Mental Health Act, IPC also has its own way of punishment for wrongful restraint and wrongful confinement. So for 3 or more days and 10 or more days, separate punishments are there for your view. Next is issuing certificate. It is a legally bound duty of a doctor to issue a certificate. So the take-home point is issuing any certificate is limited only to the doctors, and if a false certificate is being issued, punishment with 7 years of imprisonment will be attracted. So take home is, don't shine at places if you are not directly related to or not directly authorized to do that. So the reason is, Indian nurse among with the three nurses were arrested in Kuwait for issuing false COVID vaccination certificate. So this comes under this punishment. And what is a medico-legal case? So a little bit glimpse related to the medico-legal case. It is any illness, injury or infirmity to any person caused by unlawful act which requires immediate medical intervention and a legal solution later on in an appropriate manner. This exactly, in other words, to get the findings related to the injury or assault, and later on legally it can be solved. So proper what to do in such a medico-legal case, as if the field of forensic nursing, not if, the field of forensic nursing is evolving abruptly to my knowledge. So what are the points which needs to be noted in such a scenario is a proper evaluation starting from the history and counseling of the patient to get a proper history like what previous presenters they have listed, and next is examination of the patient and assisting in the examination, assisting the doctor and forensic doctor in examination of such medical legal cases initially, and later on the time has to decide, and entry in the proper entry and in the accident registered and intimation to the police. This is the main role of the nurses posted related to the forensic nursing. So a proper entry and maintaining the register and intimation to the police in such a way that the investigation can proceed further, and furnishing the opinion. So this is the mandate steps required to solve a medico legal case. So if a healthcare profession fails to inform the police according to 176 IPC, this is the punishment: 1 month of simple imprisonment and a fine of 500 or both. So causing disappearance of evidence. So in a clinical emergency department also, not only in clinical forensic and emergency department also, as nurses, you will be exposed to a lot of evidences like what Dr. Varun sir has listed. So tampering of such evidences, if it is being done intentionally to screen the offender. So if the offense was related to a capital offense, that is a death sentence, then imprisonment to the healthcare profession will be 7 years. Offense related to punishment with life, it relates, then 3 years of imprisonment will be attracted. An offense punishable with less than 10 years of imprisonment, in such a case 1/4 of the longest term of the punishment will be given to the healthcare profession. So section 202 IPC, it is intentional omission to inform to the police. So in such a scenario, 6 months of imprisonment and fine or both will be attracted. So being in the initial progress of forensic nursing, at the later stages, if you may be also required to sign in the reports in such a scenario. So how we have to act to the summon. So that is also a important thing which needs to be understood. So section 177 IPC deals with non-compliance to summons. So if not obeying a legal order which is being issued by the police officer attracts this punishment, and not attending to the court of justice, if the summon is issued from the court, in such a scenario, simple imprisonment for 6 months of or fine up to 1,000 will be charged. And section 187, it is omission to assist the police. So assisting the police is a part of investigation, and if we fail to do that, it goes against the law. So it attracts the punishment as mentioned. Next is a virtual scenario. Let me create. If suppose a healthcare profession happens to see a patient with vaginal laceration, and on the due course of investigation or history eliciting, at the time it came to be known as she is a victim of rape, and the patient says that not to inform the incident to the police. So what, as a healthcare profession, we will be doing? So if we inform the police, then we are safe.
Set facility is co-host now.
Am I in line?
Shweta, is it audible?
Yes, ma'am. Yes, ma'am. You're audible, ma'am.
Am I in line?
Yeah.
Recording
Yes,
in
sir. You're
progress.
audible.
So where exactly the slide got cut?
Next.
Okay, so what are the do's and don'ts related to the public servant? So section 175, it attracts omission to produce the document or any electronic record to the public servant. It attracts the mentioned punishment, and to the court of law, it attracts 6 months of simple imprisonment or 1,000 fine or both. So the same thing, if it is being distracted, same electronic record or a document is being distracted, in such a scenario, imprisonment for 2 years will be attracted. And refusal to oath comes under, it is defined under section 178. So if you are being summoned as a witness in a court, so it is you are bound to undergo you are bound to take the oath. So in such a scenario, if you refuse it, 6 months of imprisonment. On the other hand, if you refuse to answer after taking the oath, it attracts 6 months of imprisonment. So section 180 IPC refuse to sign the statement recorded in the court. So once you dispose your witness, you give your witness in the court. After that, if you refuse to sign, this attracts 3 months of imprisonment or fine of 500 or both. So section 199 is false statement which is being given under the oath. So it attracts 7 years of imprisonment. And if you give false evidence, this is called as perjury. If you give false evidence in such a scenario, then 7 years of imprisonment in the court of law. Or if you give a false evidence to the police or others, it attracts 3 years of imprisonment. So finally, to brief out, so for a healthcare professional related to MLC, in all medico-legal cases, such as an injury assessment, let it be an examination of rape victim and accused, drunkenness, age estimation, or any postmortem examination, never refuse to examine, including starting from the counseling, and issue the opinion within 24 hours. This avoids unnecessary claims related to the tampering of the evidences or tampering of the report, or the examination which is being conducted, and preserve the evidences, as much as evidences as possible, like enlisted previously, and assist the police. If you don't assist, then you are against the law, and attend the court with minimal amount of knowledge which enlisted above. So law is for all, and it includes you too. And if you abide by the law, you will get protected. If you evade the law, you'll get projected. So with this, I'm concluding the topic. Thank you for queries. I've given my email ID for future queries. And I take this opportunity to thank my head of department and my faculties, Dr. Abhishek Yadav sir and Dr. Kulbhushan sir, for giving me an opportunity to share this session. Thanks a lot. Thank you.
Sweta, is it audible? For such an elaborated presentation of Indian judiciary system, even though we are Indians, we are not so much aware about what are the judicial system that we have in our country. So being a health professional, we all need to be aware about that, what we are supposed to do and what we are not supposed to do. So thank you so much for a detailed presentation. So ma'am, I hope we are not taking up any more questions right now. Can we move on to the validatory function now? Yes, I think it is already 1:10 p.m. Yeah. Okay.
They can post the questions in YouTube, and probably in YouTube we can answer their queries, because the subject is totally new. There are many queries from the participants. We will organize again similar sessions, because there are many requests which we have already received.
Okay.
We'll proceed with the validation.
Yeah. Thank you so much, ma'am. So with this, we have come to the end of. I request you to sit down over here.
Whole unit in forensic nursing syllabus we have given to you. Thank you so much for highlighting very clearly what is directly applicable to us, and where we need to be careful and where we need to be performing. Thank you very much.
Thank you.
Yeah. With this, we come to the formal. We come to the end of our formal program. To begin with the validatory session, I would like to call upon Dr. Abhishek on the dais and Dr. Venkatesh. Please join with me, and Dr. Kati also, please. So you four can have a seat on the dais and for the validatory function. Please sit. You can have it for that. Please sit. Okay, in this validatory session, I would like to welcome all our participants once again, and all our speakers and the resource persons who are quite experienced persons from our department, and our other faculties from the other department also. So now, to begin with this validatory session, I would like to call upon our guest, Dr. Abhishek, who had tirelessly contributed in organizing this 2 days faculty development program, and who had agreed to be wholeheartedly to be part of this, and our Dr. Lata Venkateshan, who is always a pillar of support for all of us. So now I would request Dr. Abhishek to say the few words to the participant regarding this faculty development program.
I will just say that because there are many challenges and many roadblocks. So because we are working in different setups, so sometimes there are different set of tools applying to one setup and sometimes different set of applying to different setup. But we should not give up. Okay, we might not be able to bring a sudden change, or you can say sudden improvement in one day. But we should not stop our efforts, because small steps and small efforts ultimately leads to the larger benefit of the society. And like so many people have sensitized, like more than 1,000 people have been sensitized by this faculty development program. So I sincerely and seriously hope that the higher authorities or the ministry might take a cognizance, and they might start up a postgraduate certificate course or diploma course in forensic nursing. And AIIMS being the torch bearer, and the College of Nursing is one of the premier institute of the nursing course in India. So, with a common, you can say, cooperation, we could start uh, such type of courses. Like many queries come after that, so that the nursing professional will have the legal validity also to take the samples and preservation and all those stuff. And it will not only help in the, you can say, doctors or the hospital administration, hospital setup, but it will be immense contribution for the getting the justice to the victims of the sexual assault, to the abuse, and children particularly. So I think by these words, I wish all the best to the College of Nursing, Dr. Lata Venkateshan, and her, what should I say, laborious juniors and colleagues for holding further such sessions in future. Thank you.
Now I would like to request our Madam, Dr. Lata Venkateshan, to say a few words regarding this faculty development program to the participant. Over to you, ma'am.
Yeah. So first of all, I have to thank the Department of Forensic Medicine, especially the Professor and HOD, Dr. Sudhir Gupta, and Dr. Abhishek and Dr. Kulbhushan Prasad, and all the other faculty members who supported with their enormous knowledge and expertise in the field. The examples were really like adding value to the course, you know. We will not be able to get such kind of example because AIIMS New Delhi has got that kind of exposure in handling difficult forensic cases, controversial forensic cases which were appearing in the media all over the country. So I think the participants are very fortunate, and College of Nursing is also very fortunate to get associated with the department and host this session. This is the maiden venture. I am sure many such programs have to be organized in future because this is just like an overview. And when we saw the participants who are staying connected in the YouTube channel as well as in Zoom link, it shows that always we were maintaining around 1,000. Only few were leaving and again joining. Maybe they had a break for tea break or bio break, but again they were joining. So this shows the holding the participants shows how the sessions were very interesting, how the sessions were welcomed by the participants. And I was also personally attending 2 days all the sessions because totally new knowledge for us. We do not know anything related to forensic nursing, neither the terminologies nor the procedures, our responsibilities, legal implications. It was really enlightening, and thanks Dr. Abhishek Yadav, especially. I know how busy you were with visiting various other forensic departments in the country. Still you were able to help us without any showing any of your stress. Very smoothly helped us to host this program from the beginning until the end of this valedictory session. So my personal and sincere thanks to Dr. Abhishek Yadav. And I was just wondering, in spite of handling all these difficult cases, how you are remaining so balanced emotionally, you know, because I have never seen you expressing your stress
Madam has
or
told you, no?
tight schedule. I think that
Madam told
requires
you on the day
for a
for validatory
forensic
photo science you
expert
will be doing.
emotionally balanced in spite of handling the odd situations. Because listening to all the examples, I was
You have the
thinking it is
schedule
not
with
a
you.
very
You have the
pleasant
schedule with
field
you.
to
You
work,
have the
you know,
schedule with
because
you,
we
na?
are seeing the cases which are criminal in nature, and
Right.
which is not very pleasant for us. You know, we see the human beings suffering unnecessarily
It's
without
okay.
any
Anyhow,
cause.
I'm not doing.
So
I
children
cannot
are
do.
affected, and women are affected due to sexual
It's
offences.
okay.
So we feel really, what to say, pitying the victims of such cases. So handling the victims as well as accused and maintaining your emotional balance is something amazing which we have noticed. And so forensic nurses are required to be prepared for the country. At least now we have recognized the need where the lacunae was existing. I'm sure in future more such courses will be conducted, and we have to concentrate upon the skills, especially forensic nursing skills, how to collect history from the victim, from the accused, and how to observe for the evidences, not to miss out any of the evidences, collect the evidences using appropriate technique and forwarding it in the due time. and subsequently any queries related to the evidences we must be prepared to answer. All these require skill-based training. So in future also we would like to stay connected with forensic department, and we have the responsibility of training the faculty and nursing students across the country, because many colleges do not have the privilege of working with forensic medicine department. Especially in nursing, we have many standalone colleges of nursing which are not attached to medical college. Only very few percentage of nursing colleges are attached to private medical colleges. There also forensic medicine department might be there, but they may not be handling actually the caliber of cases which AIIMS is handling. So we have a huge responsibility of taking up this forensic nursing training forward in our country. Thank you very much, and I must thank Dr. Rati Balachandran, Assistant Director General of Nursing, because she has accepted our proposal and facilitated the approval from Dte.GHS and mobilized technical support from the ECO team. And the program is conducted without any difficulty because of the ECO team, because they helped us in designing the entire program by preparing the link and by helping us to prepare the pre-test post-test in the Google Forms and hosting the event, all those things. My special thanks to Shweta especially. It's hardly few days, I think only from last Saturday we got connected, and within a matter of 2 or 3 days we could host the program successfully. So thank you Shweta and Eunice, am I pronouncing correctly? Eunice and Manpreet. Thanks to all of you for hosting this program. And my must thanks Subala and Ms. Cecilia, also the faculty team who were helping me in organizing this program. And with this, I wish all the participants to stay connected with us in future and support all our programs which we are organizing. Thank you so much.
Okay, thank you so much, ma'am, for your speech and this addressing the participants in the valedictory session. Before I conclude the program, I would like to tell to the participant that it is just a beginning. You have lots of queries because in these 2 days, because it was something different, which was totally new for all of us, and we have to come across a long way in the future also. So keep connected with us, and we're looking forward to organize a many more program like this for all the faculties in the other nursing schools and the colleges across the country. And finally, once again, as Madam has said, even I would like to thank once again Madam, our Director Sir, for providing us the permission and for always being a support for us, and Dr. Rati Balachandran Ma'am from the Ministry side in the Nursing Division, and our special thanks to Dr. Lata Ma'am and Dr. Sudhir K. Gupta Sir from the Department of Forensic Medicine, and all the speaker, Ms. Nicole, Dr. Tabin Milo, Dr. Kulbhushan Sir, Dr. Abhishek Yadav, Dr. Varun, Dr. Swati, and Dr. Kartik, Dr. Avilash, and Dr. Venkatesh. So, and thank you so much all the speakers for your commendable job and for your way of interacting with our participants. Once again, I would like to thank all the participants and all the speakers from the bottom of our heart, and for this remarkable journey to begin in the future. Thank you so much, one and all, for joining with us. Thank you so much.
And announcement to the participants, post-test link is shared in the chat box as well as in the YouTube chat box also. It will remain active for another 1 hour, and the certificate will be issued to the participants who are doing the post-test. So please make sure that you are doing the post-test. Some participants have missed the pre-test because you have joined late, but unfortunately we cannot continue to share the pre-test beyond a particular time because the scores will be affected. So now please make sure that you are attempting the post-test, which will give us the feedback about the effectiveness of the program.
Okay, thank you so much, sir,
Okay.
to being with us.
Okay.
Thank you, Dr.
Okay, ma'am.
Thank you, Kartik. Thank you so much, sir.